Good evening and welcome to the Tuesday, May 5th, 2020 Township Committee meeting. We will now salute the American flag. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we start our meeting with the statement, I would like to have a moment of silence for two individuals which we've lost here in our Maplewood family. First, Daniel Pierce, who was a Maplewood jitney driver. He was a jitney driver and a Maplewood employee for 15 years. And unfortunately, he lost his life to COVID-19. So I'd like to have a moment of silence for Daniel. Thank you. And thank you, Daniel, for your service to our community. I would also like to have another moment of silence for Alice Gordon, who was the mother of our chief of police, Jimmy Duvall. So a moment of silence.
Okay, it'll start in a minute.
Thank you.
No, hit skip.
Thank you. Pursuant to Section 5, Chapter 231, Public Laws of 1975, this is to state for the record that adequate notice of this meeting has been provided to the public by posting and maintaining the annual notice of regular meetings on the bulletin board of the municipal building, by mailing the annual notice of regular meetings for 2020 to the News Record and Star Ledger in December 2019, and by filing said notice in the office of the township clerk.
Adams.
Here.
Mr. Daffis.
Here.
Mr. DeLuca.
Here.
Mr. Lembrick.
Here.
Mayor McGehee.
Here.
Whereas Chapter 231, Public Laws of 1975, commonly known as the Open Public Meetings Act, requires that all meetings of public bodies be open to the public. And whereas Section 7A provides that the governing body has the discretion to permit, prohibit, or regulate the active participation of the public at any meeting, and whereas it desires the governing body to comply with the provisions of this act, same time to conduct its business in an orderly and expeditious manner, now therefore be resolved by the Township Committee, Township Maplewood does hereby prohibit, except as set forth in the formal agenda, active participation in the deliberations of the governing body by the public, and except as otherwise prescribed by law, observation of the actions and policies of the body at all of its regular and special meetings.
So moved. Second.
Ms. Adams?
Yes.
Mr. Daffis?
Yes.
Mr. DeLuca?
Yes.
Mr. Lembrick?
Yes.
Mayor McGehee?
Yes. And thank you, Ms. Fritzen. And again, welcome to our May 5th, 2020 Township Committee meeting. Happy Cinco de Mayo for some. I'm going to briefly run through our introduction of the agenda. And then at one point, U.S. Congressman Donald Payne will join us and provide us with an update regarding initiatives happening in Washington, D.C. related to COVID-19. But first, a run through the agenda. Tonight, we'll be recognizing two employees as employees of the month. So we have two employee spotlights, one employee from our public health division and another who's part of our township administration. We also have two proclamations on the agenda for this evening. One in appreciation of Ed Galante, who was our tax assessor for many years, and the second in regards to Mental Health Month. We will then have our first public comment session for agenda items only. From that point, we'll move into our Board of Health meeting, which promises to be very robust. I know a lot of people have had a lot of questions about issues and resources related to COVID-19, and our health division has put together a phenomenal and robust presentation, which they will lead us through shortly. After that, we will conclude with our Board of Health meeting, and then we'll move into two ordinances that are on introduction. One is related to vehicles and traffic. And then the second one is related to our bank cap. After that, we will go ahead and move into the introduction of the municipal budget. We'll read a resolution in that regard. And then from there, we'll go into our reports by departments, which will actually consolidate into our administrative reports, where we'll hear from our township administrator, our township attorney, and our township clerk. After that, we'll hear our reports from the elected officials. And then from there, we have 3 discussion items this evening. One related to the grace period extension for taxes. We also are going to talk about our liquor license process and kind of going back to our historical method. And then finally, we'll have an update from the Office of Emergency Management. Tonight on our consent agenda, we have 8 items. We'll be looking at the submittal of the municipal recycling tonnage grant application, cancellation of unredeemed checks. We have a resolution on here regarding our Wi-Fi project, bills and claims, establishing our 2020 super fee. We will actually be formalizing a resolution extending the second quarter grace period for taxes. And then we'll have the approval of our regular session minutes and then the approval of our closed session minutes. At that point, we'll have our second public comment, and that'll be on any subject matter. And then finally, we will adjourn. So not as robust as the previous couple of meetings, but still a lot of good content here for this evening. Is the congressman ready? And at this point? Congressman Payne, are you on the line?
He is on the line. We can't hear him though.
Congressman Payne, I believe you might be muted. I do see him there, yeah.
There he is.
Yeah.
Awesome. If everyone else could mute their phone for the congressman, that'd be great.
Good evening.
Good evening.
Mr. Mayor?
Payne, how are you this evening? Thank you for joining us.
Oh, it's my honor, my honor. Sorry, this situation was going on for quite some time, but we've been touching each community in alphabetical order. So Maplewood was a little down the road. So but we've made it here, and I'm really glad to be with you to just let you know that we've been fighting and working for Maplewood and the constituents of the 10th district in Washington during this whole pandemic. We've been successful in getting some monies and relief to the American people, but we need to do more. And as we go through this process, it's a learning experience for us as well. It's unfortunate, but there are people that always are able to find loopholes in the legislation and take advantage of it. But as we move forward, we evolve that legislation to make sure that we have the oversight that we need and feel is right for the American people. So we're very, very diligently working on relief to the American people. We have our next iteration of the CARES 2 package will be coming up, but it's unfortunate today that we hit a snag where I believe that there are reports that Senator McConnell says that he's going to take a pause and step back for a minute before any other relief goes out in legislation, and that is very disturbing to a member such as me, knowing the need in our communities on the ground, and I don't understand why he can't see that being a member of the legislation and representing an entire state and the need that there is in his community. So it's very frustrating, but we're going to continue to fight. This next iteration is very important to state and local governments, I believe. We have been attempting through the last two packages to raise the issue around state and local governments and what this pandemic is going to do to their budgets. The same member of the Senate had some very disturbing things to say about that piece of legislation that we're trying to push for state and local governments. He believe he was quoted as saying, well, let the states go bankrupt. And that is just untenable, unacceptable type of rhetoric that we need in this country. That is the leader of the Senate saying those things, and that should be frightening, worrying, and disturbing. But it's really a pleasure to be here with you. Senator Menendez, we at the New Jersey delegation, we're very fortunate. I think we have the best delegation in the Congress. I might be a little biased, but I'm fairly objective, and there's not a group of members that meet and works together like the New Jersey delegation. And with my reference to aid to state and local governments and direct aid, and Senator Menendez was the person that introduced the $500 billion aid package to state and local governments. So we're all on the same page. We understand the needs of our communities and continue to try to push. So I want to discuss two important topics right now. The coronavirus, obviously, and the 2020 census. As we've seen, the coronavirus has created, a public health and economic crisis in this country. In Essex County, we've close to 15,000 cases and almost 1,300 deaths. And I believe we've gone over the 1,300 death number from this disease. And in Maplewood, there are 260 cases and 21 residents have passed away. I know that Overlook Medical Center and Summit and St. Barnabas Medical Center, Livingston have been very busy in trying to handle all the coronavirus cases. But we'll not get back to normal in this country without testing and increasing testing. There are many people walking around with the virus that do not know it because they haven't been tested, and numbers will go up because as we test, we will find more people affected by this disease. In Congress, we've passed the fourth coronavirus stimulus package last month, as I stated, and we're working on the fifth. And it included $25 billion to enhance the country's ability to test Americans for this disease. Also, we authorized $75 billion to get more protective gear and supplies to our courageous medical workers. But patients and medical staff are not the only people suffering right now. We know our small businesses are on life support. As a nation, we have really already gone through the first $349 billion in stimulus to small businesses across the country. But as I stated, it's unfortunate that people that should not have gotten the money were able to access these dollars through relationships with banks. We found situations where financial institutions were contacting good customers of theirs and offering them this stimulus money. We see the Los Angeles Lakers, Ruth's Chris Steakhouse, and Shake Shack restaurants all had to return money that that they should not have applied for during this package. And so, there have been criteria put on this money now that companies have to answer before they can access the money. They potentially may be awarded the money, but then they have to answer this criteria. and 9 times out of 10, they're not able to get the dollars. So, as I said, we're evolving our legislation as we find loopholes, and the next package will be tighter. And the next package will finally get down to businesses like we have in Maplewood and in Irvington and Newark. Springfield Avenue, all through Maplewood Township, down in the village. All those great restaurants and small businesses need the opportunity to access these dollars. And what we're doing as the Small Business Administration and the Small Business Subcommittee, headed by Nydia Vasquez in New York, is trying to now identify companies with less than 25 employees. When the SBA talks about small business, they're talking about companies with 500 employees or less. And that's not a small business. That's a small business to the SBA, but a small business is what we know. Roman Gourmet and all the great restaurants and stores in the village and up on Springfield Avenue. So we'll continue to fight to make sure that they are not left out of this, and the money gets down to people that are in the grassroots and on the ground. The fund that we have in place now provides forgivable loans to help small business pay their employees through this crisis, and that's what the next iteration will continue to show as well. But this money must go to businesses, like I said, that need it the most. I think of Valley Street, and all of the great businesses, small businesses that make Maplewood what it is. And I was furious to read that large companies took that stimulus money. They have other ways to get funding right now, but our small businesses really do not have those resources, as I stated. That's why we made sure that to include $60 billion for community-based lenders, as well as small business, small banks, and credit agencies. These are the firms that drive development in our low-income, underfunded, and smaller township communities. And they provide resources to our women and minority-owned businesses as well. Also, we allocated an additional extra $10 billion to the Emergency Economic Injury Disaster Grants Fund. And that's something that maybe you should write down. The Emergency Economic Injury Disaster Grant Fund. We did it so small businesses with less than 500 employees can get the funding needed to survive. So personally, I'd like to see the same support for companies, as I stated, for less than 50 employees. So my website has an entire page really dedicated to helping my constituents apply for benefits from our aid packages. And so please visit pain.house.gov. It contains links to agencies and departments to help you get those funds, as well as unemployment benefits if that is something you're seeking. Also, it has information about how to keep your family safe. Again, that's pain.house.gov. And if you have any specific requests, please call my district office. We're there every day, and we have not left our post since this started. You can reach my staff at 973-645-3213. 973-645-3213, and we will continue to serve the people of the 10th District and Maplewood specifically as we speak to you tonight. So we're on the job to help you get what you need. There are more actions that I've taken to help you during this global pandemic. I heard that our essential federal workers only get hazard pay if they catch the coronavirus. I have a bill that's going through the House now that would give them that extra pay just for being on the job during this national crisis. There's no need, there needs to be an incentive for them to come to work during this crisis and not wait until they get sick to compensate them. So these are airport security agents, daycare workers, and veteran healthcare assistants that cannot afford to take time off. They're risking their lives, and we need to reward them for their efforts. It's just the right thing to do. Also, I'm working to get New Jersey the additional medical supplies it needs to treat patients with coronavirus. For example, I found a new ventilator design at the University of Minnesota, and working with another member out there, we sent a letter to the Food and Drug Administration to review it, and they approved it. And my request a week later, and now we have that working prototype in the hopper, and it's something that local companies can produce very quickly, and is approved by the FDA. In addition, I asked the FDA to approve a local face mask for national use, and we are still low on those supplies. So I'm doing everything, I really can try to help during this issue. And as we get ready to discuss the fifth stimulus package, I thought about other Americans that need help. I thought about dialysis patients like me who cannot afford to stay home. We have to go in for treatment 3 times a week. So that's 3 times a week that we're taking our lives into our hands and potentially exposing ourselves to the virus and the people that give us the treatment. So we need life-saving treatments that put us and our caretakers at risk every day. Also, I'm extremely disturbed to read about the possible increase in domestic violence and child abuse during our stay-at-home period. When this is over, those victims are going to need our help. And I want to make sure that our centers are ready for them when they arrive. So I wrote a letter to the House Speaker minority and the minority leader to provide money for dialysis patients in domestic abuse centers in the next stimulus package. The other major issue is the census. And more than 2/3 of Maplewood residents have responded to the census, and that is pretty good. The state average is 52%, so you're very well over the state average, which is good. That's really, really outstanding, to be honest. But we cannot rest until it's 100%. It is quite a coincidence that the coronavirus has exposed the vital importance of proper population counts. Without strong census participation, communities really could lose funding for hospitals, medical centers, and first responders. And the funds for the roads that get you from a patient's home to the hospital bed are impacted by the census and what the federal government will send back to you in dollars. So officials extended the deadline to file your census form. But that's really no excuse to wait. All of us must get the word out to our residents to fill out the census. It doesn't cost anything, but it could really cost you everything. So, I've been fairly long-winded. I'm usually not this long, but that's all I have for right now. And thank you for inviting me this evening to be here. And I'll attempt to entertain any questions you have.
Well, first and foremost, Congressman Payne, we want to thank you. Thank you for being with us this evening. Thank you for your service. Thank you for your commitment to our community and to the whole state of New Jersey. We greatly appreciate your service, you being down there in DC and fighting for us. I know we do have and also before I go, I shall let you know, we have been working diligently on our census. We are continuing to do targeting emails and communications, and we will not rest until either we're 100% or we're 1 point over South Orange. So don't worry about that. We do have a few questions that have been submitted. If you have some time, if you will, we would love to
Absolutely.
ask a few. Myself and
Sure.
our assistant township administrator have a few of them. So I'll ask one, he might ask another, and we know if it gets too long, we'll go ahead and provide them to your staff at a later date.
Well, I mean, anything I'll entertain them. Anything I can't answer, I think I have several staff members on this call as well, and we'll be taking notes. And we normally are, depending on the difficulty, we usually respond in a day or 48 hours. But depending on the complexity of the question, dictates the amount of time it takes to get back. So, shoot, fire away.
Thank you, Congressman. The question that I have, the first one I have is from Ms. Deborah Engel, who is a small business owner on Springfield Avenue. And her question is, when will the PPP forgiveness guidelines be issued by the SBA? And can our representatives urge them to publish the guidelines as soon as possible?
Yes, I think that's something that is not very difficult to get published. I think that's just a matter of us going back and asking, and if we can get the citizen's name and address and number, we can definitely get back to her and even let her connect her with the SBA in terms of answering specific questions and opportunities for her to benefit from the PPP.
Thank you, Congressman.
I have a question from Joy Yagid. Says, I am a single member LLC operating as a sole prop. I just received closing docs for my PPP loan. I'm in need of cash, but I'm afraid of the unknown terms of use and forgiveness. How can I wait to hear back from the SBA and not spend the money? Once the money hits my account, the clock starts on the 8 weeks. How does this work? It's not fair not knowing what the rules are. I am concerned because the guidelines are not clear as to forgiveness. If I pay myself for 8 weeks, it's not clear. And lastly, how do I apply for forgiveness?
Okay, well, you would just apply at the SBA website. But once again, if you contact my staff tomorrow at 973-645-3213, we'll help you navigate that right away. So contact my office. I believe Michael Gray will be in the office. And the number, once again, is 973-645-3213, and we can help you with that navigation through that with the SBA.
Thank you, Congressman. I have one more question. This is from a resident, Ritu Pacholi, and her question is, it's long, so I'll try to truncate a little bit here. As an attorney, many of my clients' neighbors have been informed that the pandemic unemployment has still not been paid to independent contractors. They have properly applied for unemployment and have been denied, but still have not received benefits that are crucial for their day-to-day living. What can be done to address this crisis? And that might be very similar to what Joy said, but that's the question.
Okay. Well, I'll have to look into that. I'm not familiar with any class of individuals that aren't entitled to the unemployment. As a matter of fact, it's been fairly generous in taking in people. That's really a state issue, but we can definitely research that and get an answer from whomever we need to. The state unemployment is probably where that question lies. Why they would not, why people would not qualify at this time. The federal government is providing all the money that they need in terms of unemployment benefits. So there is no shortfall in that area. So I don't understand why any person in the state that is in need of unemployment and can justify it is not eligible. So please call my office or have the individuals call my office tomorrow at 973-645-3213, and we have a direct line to the state unemployment office, and no hesitation on getting through. And we offer that service to any resident that's having problems getting through to unemployment. So, Vic, you look good.
We have just one more. It's a two-parter related to unemployment from a Karina Stump. Are you aware of how many of us have yet to receive any assistance, and how come the system keeps crashing? Question 2, many of us are being granted a mortgage forbearance, not a deferment. This means comes July and August, we are expected to pay the entire 3-4 months at once. Is there any discussions on this matter?
Yes, there's great discussion about that, especially for states such as New Jersey, New York, California, Connecticut, that had the SALT issue as well. So that's been a great conversation, very important conversation in the Financial Services Committee with Maxine Waters. And they're looking at the issue, and they understand that the forbearance, how much of an impact that's going to have on people when that bubble is comes due, and how people would have that amount of money at that one time is difficult to understand. So that is a big conversation in the Financial Services Committee, and what I will do is on the we have a conference call 2 times a week with the entire Democratic caucus, and all the chair people are there to answer questions. And so I will raise that issue about the forbearance and the SALT payments that we've been fighting for as a delegation. Bill Pasquarello heading the delegation on that fight, but it's a definite issue that's been discussed, and we understand what it means to homeowners at the end of that forbearance. So we continue to try to work through and find an answer for that situation that is going to present itself after 3 or 4 months.
Thank you, Congressman. I think there's just one more question. We also are streaming this live on a YouTube channel, and I think Mr. Walls has a question for us.
Yes, Mayor. So I have a few questions, actually. I'll start with the first one I received. The first one is from a Catherine Dial at 33 Concord Avenue in Maplewood. The question states, Bank of America is giving me trouble with PPP and offering a loan 1/10 of need. I cannot get a hold of anyone at Bank of America that can help. How can I contact the SBA? Additionally, when can we expect UI benefits to come through? It says it's been pending for 8 weeks now.
Which benefits?
Yeah, the UI benefits.
Unemployment.
Oh, okay.
No, I think it's PPP.
No. UI. Unemployment.
Yep.
Okay. I think I didn't answer the second part of the first part of the last question. Just think of the magnitude of people that have applied for unemployment, and you'll understand why the system is crashing. But the state has done a good job in picking up the slack. Probably not as good a job as some people would think, but they have been getting back up to speed and getting people their unemployment and even their back back pay because of the problems that they've had. So once again, I offer our number to the residents that's having problems with Bank of America and the SBA. It's 973-645-3213, and we will help you get an answer and the benefits that you deserve as an American citizen, and that are available to you.
Mr. Waltz, is that it?
I have actually two more, Mr. Mayor. The next one comes from Miss Deborah Barnett, who owns a massage/reflexology business on 1861 Springfield Avenue. She says she is enclosed since March 15th, received an acceptance letter from the unemployment, but when clarifying, it says 0 funds have been accepted.
Well, it's interesting. These questions are really constituent service driven. And so once again, you can contact our office at 973-645-3213, and we will help you get an answer to the circumstance you find yourself in. My office is really built on constituent service, so we will be able to help all of you try to get an answer to these questions, and we're here to serve you.
Thank you very much, Congressman Payne. We really appreciate that. It sounds like a lot of these questions are kind of ones where your staff can address them directly. And so, Mr. Walls, what we could do with the last question is we can get that to the Congressman's staff, and then we know that there'll be immediate follow-up.
Yes, sir.
Perfect. Thank you so much.
Mayor,
I
have two policy questions. Congressman, thanks for coming on. We had taken a position in favor of HR, let me just get the number, 6467, which talked about the state and local funding. We don't see you as the sponsor as of the time that we did the resolution of support. We're wondering if you could get on that and sponsor that.
What is it? What's the number?
HR 6467.
HR
Units of government
6467.
with population of 500,000 or less.
Oh yeah. Well, let me just say something. I may not be on that legislation yet, and I don't know why I'm not. And I hope my staff is listening, because that's problematic for me not being on that. But let me just say that in terms of that whole conversation, I've been at the forefront of it, because we understood what that meant to townships such as yours, and even as large as cities as Newark. Newark would not be eligible for the funding that they were talking about either, because they were talking about a cutoff of 500,000 or more. And myself and Lacey Clay from Missouri both raised the issue, because St. Louis is a town that is not 500,000 either. So the two of us raised the issue immediately, and to be honest, that is actually why that legislation stands. So though I'm not the author, it was two members of the Congressional Black Caucus that raised the issue and understood what that meant to the largest cities in our state and communities such as yours. So I'm on. I'm just not on the record yet, but I'm sure if you check after tomorrow, that will be rectified.
Okay, can I ask you for one other one that came to me from the Affordable Housing Network? Representative Waters is putting in a bill, $100 billion emergency rental assistance. And Maplewood, we have 25% of our population are renters, and this would be a big help. So if you could take a look at that, and also maybe consider co-sponsoring that.
Absolutely. Those are no-brainers for me. Maplewood is 25%. Newark is 65%.
Right.
Irvington is 70%. So it's conducive to benefiting my district, and you have my commitment on that.
Thank you.
Thank you. That's a great backdrop. Are you in front of Town Hall?
No, I'm sitting in my house, but playing around with the background.
Yeah, don't worry, Congressman. I got one for you. Trust me. Do any of my other colleagues have any other questions or words, comments for the Congressman?
I do, Mayor, if I may.
Please.
Congressman Payne, it's great to have you with us tonight. Deputy Mayor Dean here. It's good to see you. It's our honor to have you with us. You're looking great, by the way. I love the new glasses. I want to thank you for your leadership during this time, during these unprecedented and uncertain times. I know you've been fighting the good fight down in Washington for us, and we appreciate everything you're doing with respect to the CARES funding in particular. I know you've been a huge proponent, a lot of flexibility in those funds. I do a lot of work in the housing area, as Vic mentioned about affordable housing. We want to be able to have the flexibility to meet the needs, the urgent needs right now on the ground. Housing, as you know, in our state and across the country, it's one of the critical areas. There are a lot of inequities and vulnerabilities which have been exacerbated by the pandemic. And being able to use traditional CDBG funds, which are about neighborhood revitalization, towards rental assistance and homelessness prevention programs, and things like that are really, really critical right now. So it's a good time to use the pandemic to think outside of the box and not repackage the same old money in the same old box with a different bow. And I know that you understand this, and I appreciate your efforts. And we look forward to collaborating with you in this effort. Thank you very much.
Well, thank you. That's very generous of you. And I always tell my constituents and the leaders that I work with, I'm a tool, I'm a vessel, I'm your voice in Washington. So please do not hesitate whether you think Payne is doing a good job or Payne missed the boat on that. Please, you have to let me know, because it's the only way that I can form for you in Washington and formulate the arguments in order to bring back the dollars that you need and articulate your concerns for this country. So please use me as a tool. Continue to write my office, email me, call me, let me know when I'm doing well, and let me know when you have issues with me. That's the only way I'm able to formulate a more positive direction in representing you. And it's quite an honor to represent the Township of Maplewood. And I always try to make it clear in these opportunities, these forums, to let you know that although I was born and raised in Newark, I spent a lot of my formative years in Maplewood with my uncle and my cousin from 1970 until now. So Maplewood is truly a part of my life and my development and the man that I am. I spent a great deal of time there. And so it means a lot to me, really, in my heart. So you have a fighter for the Township of Maplewood with this congressman. So God bless you.
Mayor?
Adams.
Yes. Hi, Congressman Payne, Nancy Adams here. Nice to see you again. Real quick, Gus Henningberg is texting me to tell Choppy that he says hi. So I throw you that.
Well, now you know how far I go back in Maplewood.
Yeah, I know. Understood. So I do have a question. In the state level, I work with small businesses for the last 25 years and downtown districts. And I've had several ask me about issues with regard to business interruption insurance. They all carry business interruption insurance. the state keeps tabling, doing anything about making insurance companies pay business interruption insurance where it would not otherwise be covered because of the virus. There's precedent with post 9/11 that terrorist attacks were exempt for insurance companies to have to pay their customers for business interruption, and the state superseded that and made the companies pay. But according to Assemblywoman J.C. office, it keeps getting tabled on the state level. I don't know if there's anything on a federal level that can be done, but nothing seems to be happening with that. Is there any way you can help for these small businesses to at least get their insurance coverage to cover them during this period?
Well, we would have to look on the federal level how we could help them. There might be opportunities to compensate them, but I couldn't tell you tonight.
Right.
But that, once again, that's something, if you contact my office, we can delve into. And I could even, after looking at the information that you send, we can send a letter of support to the mayor, to the governor, to look at that whole issue and maybe reconsider the stance that the state is taking. That's really all I can do. It's a state issue, so
Yeah.
I'm the federal government, so I can only advocate as a citizen with my congressional letterhead. So hopefully that would help a bit. But
that's what we hope was.
So
Okay.
we can look to see if there's any relief on the federal level, and definitely send a letter to the governor that we're concerned about that issue and the non-payment to people, and if they could reconsider.
Okay, I'll reach out to your staff tomorrow. It would be something that would relieve the government of yet additional monies to help these small businesses if their own insurance policies could help them out.
Yeah, it's unfortunate that people take out insurance policies, and then when it's time to benefit from it, there's some reason that they're not going to be paid. There's something a little strange about that concerns me. So we definitely want to try to understand how that works. People pay premiums, and then when they have a situation, there's no payment. That somebody has to explain that to me, how that works. So
Great, thank you.
That is a good background there, Mayor.
I thought you liked that one there, huh?
I think he beat Vic. Vic, I think he beat you with this one.
There we go. Mr. DeLuca,
thank you for having me.
We have so many of these WebEx meetings. We've become somewhat of semi-experts on this backdrop. So
yeah, I got to learn that. I got to figure that out.
Well, Congressman Payne, I really want to thank you for being with us tonight. I also want to thank your staff for their support and their due diligence in helping as well. You have a great team with you and behind you. So thank you to your staff as well. And most importantly, we appreciate that your team will be ready for us. We will forward these questions along these from our residents. And we appreciate the due diligence to, obviously follow up and help them in their times of need. As you can see, there's so many people with different concerns and needs, and everyone's needs important. And we appreciate, your due diligence and willingness to look into these needs of our residents.
Well, it's my pleasure, and I'm always prepared for a very proactive interaction with the people of Maplewood. They keep me on my toes and make sure that I'm doing the right thing. So, I appreciate them dearly. So thank you for having me.
Thank you, Congressman.
All right. Take care.
Thank you. Stay well.
Take care. Bye now.
Bye-bye.
Thank you, Congressman.
All right. Take care.
That was great. Great to have the congressman with us this evening. And I will repeat at the end of the meeting, but he said his office number was 973-645-3213. And for the residents that we didn't get to this evening, we will get those questions that you provided to the congressman's office, to his staff. We'll CC you on them so that you know that we follow through. And thank you all for submitting questions for the congressman this evening. We are now on agenda item number 5, and we have 2 employees that have really just gone above and beyond in their service to us and to the community of Maplewood and all the residents. So Deputy Mayor Daftis, would you like to do the first honor, please?
Sure, Mayor, thank you. As you said, we have a resolution, a recognition and appreciation of one of our members of our public health team, our public health nurse, Anna Markarova. And this resolution is truly a very small gesture towards the enormous, appreciation and gratitude that we have for her efforts and our entire public health department's efforts right now during the pandemic. They are truly on the front lines of this pandemic. They are making sure that all of us are well informed, well guided, and safe. They're the ones who are risking their lives literally every day being on the front lines. So with this resolution, we state that the Township of Maplewood is very fortunate to have someone like Anna as dedicated and committed to our mission of keeping our municipality safe, especially during a public health crisis. We want to recognize Anna for her commitment to the residents of our town by stepping up and addressing projects, requests, or responsibilities above and beyond, and truly has been round the clock right now. That the Township Committee extends our utmost appreciation for the work of Anna and her team to make public service an exciting and joyous experience for the residents of the Township of Maplewood, and that we wish to extend our sincere best wishes for every happiness in her future and her continued success with us at the Township. So now, therefore, be it resolved that the Maplewood Township Committee recognizes and appreciates the service of our public health nurse, Anna Markarova, and wishes her well as she continues serving our township, and that this resolution of appreciation and support be duly recorded by the Township Committee on this 5th day of the month of May in the year of 2020. Thank you.
If you're there, would you like to say a few words?
Thank you, Mayor McGehee. Thank you, Deputy Daftis. Thank you, all the Township Committee members. I am so grateful for the work environment that I step into every single day, and I love the Township of Maplewood, and I'm so grateful for the people I work with, the administrators, my department heads, and most importantly, my mentor, Candace Davenport. So thank you, everybody.
Bravo. And congratulations again, Anna. We now have another employee spotlight that we're going to recognize. Ms. Adams, please.
Yes, Mayor, I'd like to very happily recognize our Assistant Township Administrator, Glenn Mcclowsky, on his service, especially during all this. Glenn is always there for any, he sort of is our pseudo IT department as well, except when it comes to turning on the computer at his own house when he's on. But no, one glitch he'll never live down. But other than that, he steps up. He's there. There he is on video and everything. Hey, Glenn. So I just want to thank him. Always there, always responsive, and always helpful, no matter what our concerns are. So I'll quickly read resolution of recognition and appreciation for Glenn Golowski. Whereas the Township of Maplewood has been fortunate to have dedicated staff committed to the mission of the municipality, and whereas recognizing this employee for his commitment to the residents of our town by stepping up and addressing projects, requests, responsibilities above and beyond. Whereas we on the Township Committee wish to extend our utmost appreciation for his work and that he's done to make public service an exciting and joyous experience for the residents in the Township of Maplewood. And whereas the Township wishes to extend our sincere best wishes for every happiness in the future and to your continued success in working here and in making Maplewood a desirable place to work. Now, therefore, be it resolved by the Maplewood Township Committee recognizes and appreciates the service of Glenn Mcclowsky, Assistant Township Administrator. We wish you well in your future endeavors, so long as they're in Maplewood, and further, that this resolution of appreciation and support be duly recorded by the Township Committee on this 5th day of month of May in the year 2020. Thank you, Glenn.
Just I'm grateful to the professional staff around me who make it easy. They've been flexible and receptive. We've all kind of had to change the way we do everything in the last month, and the support of the governing body and Sonia. It's a great place to come to work every day, and though the hours may be long during this pandemic and on other days, it's the time goes by quick when you enjoy what you're doing. And from our IT staff, I asked them about the transition to the remote work and how they've been dealing with other municipalities. And he said Maplewood gets an A+ compared to all the other municipalities, and how easy we've been to work with, and our transition to, this whole situation we're dealing with. So thank you.
That's mostly you, so thank you.
Thanks.
Congrats, Glenn. Well deserved. Bravo. We're now going to move on to a couple of our proclamations we have for this evening. Mr. DeLuca.
Thank you, Mayor. This is for a former employee who just retired, Ed Galante. Ed retired after 25 and a half years of service to the Township of Maplewood as our tax assessor. He started with us back in 1994, and he managed the tax department with sheer dedication, including handling 3 revaluations during his tenure. And I was with him for those 3, and he worked very hard and very fair in that. He acted quickly, he got information to the residents, and he tried to help as many as he could. He performed his duties throughout his years in an unwavering manner, both to the township and to its citizens. His endeavors reflected great credit upon the Township of Maplewood and Essex County. And in fact, in December of 2019, he was honored by the Essex County Board of Taxation for his years of service to the Township of Maplewood and the County of Essex. So therefore be it resolved that I, Victor DeLuca, on behalf of Mayor Frank McGehee and the Maplewood Township Committee on this 5th day of May 2020, recognize and commend Edward Galante for his devoted and valuable services to the residents of the Township of Maplewood, and we offer him our best regards and best wishes upon his retirement.
Thank you, Mr. DeLuca. Thank you.
Mayor, it's Roger Desiderio. May I just say 2 or 3 words?
Please, absolutely.
Okay, I had occasion to talk to Mr. Galante today, and I told him about the proclamation. He was very touched, and he thanks both Mr. DeLuca, you, Mayor, and the entire Township Committee. I had the pleasure of working with Mr. Galante for his entire tenure with the Township, and I think everything that's said in that resolution is absolutely true. The tax assessor's job is not an easy one. Nobody wants to see the tax assessor. Nobody wants to know the tax assessor. And it's vital, as the collector will certainly attest to, in terms of revenue and ultimate fairness that the Constitution of the state requires. And I just think he's been a credit to the community, and he thanks you all for this recognition. Thank you.
Mr. Desiderio. And Ed, if you're listening, we really want to say thank you. We appreciate you. You've definitely worked blood, sweat, and tears on behalf of this community. So thank you again. We now will have our second proclamation. Mr. Limbrick.
Thank you, Mr. Mayor. It's my pleasure to read the proclamation in honor of Mental Health Month. Whereas mental health is defined as emotional and psychological well-being, which allows individuals to work, enjoy satisfying relationships, and participate fully in their communities. And whereas 1 in 5 individuals will have a diagnosable mental health illness in any given year, whereas 1 in 25 adults experience serious mental illness, and 17% of youth experience a mental health disorder, and 25% of the US population suffers from substance abuse, anxiety, and depression. And whereas people with serious mental illness have an increased risk for chronic disease such as diabetes and cancer, and whereas studies have shown that a positive thinking mindset can improve a person's health status, such as increasing lifespan, lowering blood pressure, improving pain tolerance, boosting the immune system, and reducing depression. And whereas the collective multifaceted and global trauma and social isolation created by the circumstances of the COVID-19 pandemic has had a detrimental and profound effect on people's mental health. And whereas the Centers for Disease Control and Prevention recommend public positive messages, social distancing activities that promote a feeling of connection and solidarity during the month of May, that can help spread hope, reduce isolation, support positive thinking, and uplift the mental health of the community. Now, therefore, Mayor Frank McGehee and the Maplewood Township Committee declare on this 5th day of May 2020, as Mental Health Month.
Thank you, Mr. Limbrick. We appreciate that. And, this is mental health, especially right now during COVID-19, is so important. And what we're all experiencing is unprecedented, and it takes a toll on us, not just physically, but also mentally. So, whatever you need to do, try to do those things to maintain a sense of mental health. It's very vital because it has a direct correlation with your physical health. So we're now at agenda item number 8, public comment on agenda item only. Mr. Waltz, do we have any public comments on agenda items only?
Mr. Mayor, at this time, you have no public comment.
Thank you. We will now move on to agenda item number 9, our Board of Health meeting.
Thank you, Mayor. I will read the opening statement. Pursuant to Section 5, Chapter 231 of Public Laws of New Jersey, this is to state for the record that adequate notice of this meeting has been provided to the public by posting and maintaining the annual notice of regular meetings on the bulletin board of the municipal building, by mailing the annual notice of regular meetings for 2020 to the News Record and Star Ledger in December 2019, and by filing said notice in the office of the Township Clerk. Ms. Fritzen, roll call, please.
Mr. DeLuca,
Here.
Mr. Lembrick,
Here.
Mayor McGehee,
Here.
Mr. Daffis.
Here.
Whereas Chapter 231 Public Laws of 1975, commonly known as the Open Public Meetings Act, requires that all meetings of public bodies be open to the public. And whereas Section 7A provides that the Board of Health has the discretion to permit, prohibit, or regulate the active participation of the public at any meeting, and whereas the desire of the Maplewood Board of Health to comply with the provision of this act, same time to conduct its business in an orderly and expeditious manner, now therefore be resolved by the Maplewood Board of Health, Township of Maplewood, does hereby prohibit, set forth in the formal agenda, active participation in the deliberations of the Board of Health by the public, and except as prescribed by law, does limit the public to the observation of the actions and discussions of the Board of Health at all its regular and special meetings.
So moved. Second.
Ms. Adams,
Yes.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee,
Yes.
Mr. Daffis.
Yes.
Thank you.
Thank you, Ms. Fritzen. I make a motion to approve the minutes from our last meeting of April 7th with the minor edit to indicate that Ms. Adams was running a little bit late that night and was not able to join us at that time. Do I have a second?
Moved. Second.
Ms. Adams,
Abstain.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee,
Yes.
Mr. Davis.
Yes. Thank you, Ms. Fritzen. And now we're going to move over to our incredible, remarkable public health officer for her report, Ms. Candace Davenport. Ms. Davenport, I believe you have a couple of announcements before you get into our presentation for this evening. Go ahead with the announcements. I have a couple of my own as well to supplement yours, and then we'll get into our presentation. Thank you.
Okay, thank you. I just want to say thank you so much for the recognition of Anna Markarova. She's an amazing asset to the Public Health Division. This really would not have been able to be done without her. She's a terrific asset and a wonderful, wonderful employee and friend. And also for Glenn Mcclowsky, he's been amazing in helping us with all of our IT and just a really great resource. So thank you to both of them. I want to also say support for the resolution of May as Mental Health Month. It is so important and vital that we recognize it, and especially during this time as we go through it, and we're still going through it, and all of the issues that people are facing. We want to support mental health and really focus on the positive mental health that we can all give to each other during this time. And there's one more announcement, which is that we also are in another public health crisis of needing donations for blood. So the American Red Cross, along with the South Mountain YMCA, are hosting a blood drive on May 29th from 9:30 a.m. to 2:30 p.m. You should be able to sign up shortly on the American Red Cross website. Just look for Maplewood as the location, and it'll be at the South Mountain YMCA location on May 29th. And they were able to raise, the last time that they were here on April 23rd, 15 pints of blood, which saves 45 people. So thank you to all those who donated. And
Thank
Debbie,
you.
you'd like to go ahead.
Thank you, Ms. Davenport. I just want to say that for those of you out there who want to join me in some advocacy, and Ms. Davenport and our Senator Menendez, we're leading the good fight to get the FDA to finally denounce its outdated and discriminatory ban on gay blood. We especially during this pandemic, when we have such a need, there is absolutely no reason to discriminate against gay men at this time. When blood is tested, it's tested profusely, and there's absolutely no risk of HIV infection at this point. And this is science and fact, not opinion. And we have to make sure that the FDA does that accordingly. So please join me in that fight. The other announcement, I have two announcements. The county asked that we let everybody know that we can now all get tested, even those of us who do not have symptoms or believe that we do not have symptoms at the county site. You can make an appointment at the EssexCovid.org website, EssexCovid.org. Make an appointment. It's drive-through. You cannot walk up there. You will be denied access. It applies to all Essex County residents, and the testing is free. I also want to highlight that this Saturday between 8 a.m. and 11 a.m. At Our Lady of Sorrows, the Parenting Center, along with MEND, will be conducting another food drive pickup. All are welcome. No one will be turned away. No questions, no registration. So please join us on Saturday at Our Lady of Sorrows starting at 8 a.m. in the morning. So this evening, we thought we would we thought it was time after 7 weeks or so of data of living under COVID-19, of social distancing, of hearing daily reports of cases here in town, countywide, statewide, nationally, to tell the story of the virus. How does this virus work? And what does that look like nationally on the macro level, as well as right here in our community? And how did we get here? How does the virus progress? How is it, for instance, that while infections may be slowing down, deaths can continue to rise? And we also want to talk about the future. Obviously, we all want to resume life as we knew it in some form, at least, as soon as we can. We must do so responsibly. But what does that look like? Science equals confidence. That is our motto. The governor says it really well. Public health equals economic health. The data will certainly inform the dates and how we open our society and our economy again. So we prepared a presentation tonight for the public. We will make this available for distribution in social media and put it up on our website as well after tonight. I want to make a couple national remarks about the pandemic. We've been talking a lot since the beginning, since late February, early March, about flattening the curve. And it seems that we have started flattening the curve. But now we realize that flattening the curve is not the end of the game. It's just the beginning, because the pandemic has a new shape, the plateau. What is a plateau? It means that the virus continues to spread. Nationally, 30,000 cases every day for the past few weeks. We currently have in our country over 1 million cases confirmed, COVID-19 cases confirmed. And that includes over 70,000 deaths. And if our public health officials are correct, and up until now they have been, that number is going to go into over 100,000 deaths in our country in the next coming weeks. This means that while social distancing does work, and while we have been able to flatten this curve, the virus is still on the loose. The virus is not taking a summer break, and accordingly, we should not either. And of course, we know that testing is not as widely available as it should be, which means what? That the number of infected persons in our country could be far more. These numbers that we report daily could be even greater. So flattening the curve was the first step in this pandemic, in our response, but it is not the end of the game, and it is not enough. Flat is good, but round and down is better. So with that, I'm going to lead us into our presentation, which Ms. Davenport is going to demonstrate and talk about. Again, like I said earlier, we want to give a snapshot of where we are today in Maplewood: positive cases, confirmed cases, recovery rates, deaths. We want to talk about our demographics there a little bit, get into that data a little bit, and compare to state aggregate data. And we want to talk about how we got there, the progression of the virus. How does the virus work? We'll even get a little bit technical on you tonight. And testing, what testing is available? How can you be tested? What does the testing mean? If you're not positive, what does that mean? And how should you act? And what does antibody testing mean? And then, of course, as I said, the path to reopening. What does that look like? How science will increase our confidence and lead the way. So with that, Ms. Davenport and Glenn, who is our IT guru here, leading us through the presentation, if we can have it up as we're going through this for everyone to see. Let's begin with slide 3 of our presentation, which takes us into our total cases where we are today. Take it away, Candace.
Okay, hi, can everyone hear me?
Yep.
Okay, thank you. So I just want to point out here, this is the New Jersey State Health Department COVID-19 dashboard. When you go to the website, which will be in the resources section at the end of this PowerPoint, you'll be able to go to this website if you are not familiar with it already. Just want to highlight that this is a picture of the state of New Jersey, and the circles show the impact of the specific areas. So you can see where Essex is by Elizabeth in New York. And the information on Essex County is that we have, unfortunately, the highest death toll of any county in New Jersey at 1,292 deaths. The current COVID-19 status overview for Maplewood as of yesterday is that we've had 263 positive cases. We've had 423 negative cases, and 120 recovered cases. And I will talk more about that in a little bit. I also added this one additional section of probable cases. These are now cases that the State Health Department wants us to monitor, which are cases that have been in contact and are symptomatic after being in contact with a positive COVID confirmed case. So we will be monitoring those cases as well. So let me just go back.
Excuse me for a minute before we go into that. I just wanted to add, indeed, Essex County currently leads the state of all the counties in deaths at a reported this afternoon during the governor's conference, of 1,319 deaths. And according to the press conference, in just the last 24 hours, we have seen 385 new hospitalizations. There are over 5,000 people still in hospital, half of whom are in ICU. So again, while the curve is flattening, we are still seeing that this virus is very much, very strong and spreading. And our total cases in New Jersey are at over 130,593, which puts us really in the hot zone after New York State.
Absolutely. And Mr. Daffis, thank you for that great outline of the presentation and those numbers. We had anticipated that they were going to change even as right before this presentation. So thank you for giving those updated numbers. These were just even from earlier today at 2 o'clock. So as we can see, the numbers are drastically changing, unfortunately, by the minute.
Right. So Ms. Davenport, I'm going to lead you here a little bit out of order, if I may.
Yes.
Since we're talking about total cases, let's talk about the demographics of this data, if you will. Slides 13 through 17. We sort of get into a little bit what gender and age looks like, race, do we follow state trends, and what kinds of who do these cases represent? What are we seeing? What was that like a month ago? What is it like now? So starting on slide 13 and moving through slide 17, please.
Okay, sure. So let's start there. So again, we're back at the New Jersey State Health Department COVID-19 page. We're looking at their demographics. They have this really great way where you can break down the information. Let's start with the top left, which is the deaths by race and ethnicity. So this is information for the entire state of New Jersey. As your local health department, we enter in the data through the Communicable disease reporting system. That information is collected, such as deaths, hospitalizations, types of illnesses, underlying health conditions, and that gets funneled up to the state, and they're able to aggregate it. So as you can see, this information, it has the ethnicities that are affected with the number of cases and the number of deaths. At the bottom, it shows deaths by age group. You can see that the deaths don't really have an impact until you start to go to the middle age, starting at ages 30 to 49. And then it increases rapidly and exponentially as you get older. So age or advanced age is one of the major health risk factors for COVID-19 and death, unfortunately. The other major risk factor is underlying health conditions. So other underlying health conditions refers to cardiovascular disease, which, as you can see, at 58.8% make up a majority of the cases. Moving on to diabetes, unfortunately, puts you also at risk. And then other chronic diseases include mental, vision, speech, hearing, and other immunocompromised or autoimmune diseases. And then you have other issues like chronic lung disease, neurologic developmental disability, and renal disease. Moving on to the next slide. This is the Maplewood Health Department, Maplewood Public Health Division information. So we have 21 deaths in Maplewood, and those deaths are broken down by female and male. So you have 10 of our patients were female and 11 of our patients were male. And also on the number of COVID deaths, you'll see that the breakdown of the percentages of those cases. So So it's evenly spread out pretty much, but our cases don't start until your mid 40s. And those who have died have also been up into the ages of over 100. The progression of cases across the state in Maplewood, is comparable to how the state has seen their cases progress. So when we were first starting to do our investigations at the beginning of February or in the middle of February, we were really only looking at international travel. So those traveling from China, Italy, South Korea, and Iran when COVID-19 was being spread and news was going on over there. However, as we have pulled back on international travel to those locations, we were still internationally traveling throughout the country. And unfortunately, it had spread rapidly throughout other countries where we were visiting. So we pulled back and put in federal restrictions on business and leisure international travel. And we saw a decline in those types of cases. But then we started to see cases of domestic travelers, both business and leisure. And once we put down, we prohibited that, we saw a decline in those cases. However, then we started to see attendees of large gatherings or conferences. We'd see cases of that. So pulling people back to gatherings of 100 to 50, we saw a huge decline in the number of cases from that. And then we started to see cases working in New York City and those who use public transportation. And I think because of where we were and because of the impact that was happening greatly in New York City, we had then bringing us to March 21st when the governor's stay-at-home mandate was issued at March 21st. I want to highlight our colleagues at the healthcare system. COVID-19 has really shown us that not only is public health and healthcare always been a connected entity, but healthcare was dependent, and it's so dependent still on our ability to stay home. We watched our healthcare system literally buckle and crumble in certain areas, and the fissures in the healthcare system was unbearable at some point. We were not prepared for any, we didn't have enough PPE. We weren't sure if we had enough ventilators or equipment. And the cases just kept coming and hammering. And it was really very scary. So the stay-at-home mandate, when we go over the data, you'll begin to see that the social distancing makes the difference. And the reason why we're staying home is because of them, and to give them time to recuperate, revamp, prepare, so that we don't have to make hard choices like who will be given care or not, or will there be a bed for me? And hopefully we'll be able to have visitors again in the hospitals if COVID can be under control. So I just want to bring that to everyone's mindset, that they are the reason why we're staying home, because if they aren't ready, or if we don't have a healthcare system, we won't make it. We just won't. So unfortunately now, because we are all staying home for the most part, the ones who are getting sick are the ones who can't. So those are your healthcare providers, our first responders, and our essential workers, those people who have to go to work in order for our country to still continue and our society to continue. We're also seeing cases in the elderly in long-term care facilities and nursing homes. This was devastating, as you can imagine, with COVID-19. As I said, advanced age is a major risk factor. And so we saw throughout the state a lot of deaths in our nursing home facilities, which impact the numbers in towns that have long-term care facilities, one or more. So bringing us back to the state health department data, you'll see that 508 facilities in New Jersey have had outbreaks. And again, you can see the impact by the circles, and you can see where it's impacted. The Northeast is greatly impacted, but it starts to move down further, both south and west. And the number of cases at long-term care facilities keeps growing, and that's unfortunate. And again, the most impacted are the residents of those facilities as well as the staff. And then I want to add to that the families of all of the healthcare workers, essential workers, and everyone who is still working. And I believe that takes us to our essential workers. Would you like me to continue from here, or would you like me to?
I think I want to stop here for a minute and just kind of zoom back macro and just talk about how would you say then, in your experience, that our demographics reflect state aggregate data in terms of race, gender, socioeconomic class, et cetera?
Yes, absolutely. We are a small microcosm of the impact at the state level. But every township, every region will be different, right? So when we listen to state phone calls, those who have migrant farm workers have an issue that we don't have here. Those who have correctional facilities have a different impact. Those who have more than one long-term care facility, which we have one long-term care facility and one senior apartment building and 9 group homes and 1 dialysis center. Those things make us unique and are our strength. But for many places that have 3 more or 11 nursing homes or long-term care facilities, they are seeing a bigger brunt.
Right. How would you say that we compare to municipalities who are similar in population size, density, and socioeconomic demographics and diversity?
Right. So I just want to reiterate on one of my slides, based on the U.S. Census data, we are approximately at 25,000 residents. We kind of fall in Essex County right in the middle. There's not many people who are about our size. But what makes us different is I mentioned the vulnerable population. We are a population of 25,000. We have a working class population who are the workers in healthcare and essential personnel that I mentioned. They are also our strength because they add to the diversity of Maplewood and why Maplewood is really special. I also want to mention that we have multifamily housing units. So we have many families who live in Maplewood, some who live in multi-housing dwellings. COVID-19 tells a story about density. It's about close proximity, and that's how it can spread, unfortunately. We also have, unfortunately, an uninsured population, so access to care can be an issue. Based, again, on the U.S. Census data, 6.7% of our residents in Maplewood under 65 years do not have health insurance. And 24% of our residents are ALICE qualified according to United Way, which is access limited, income constrained, but employed. And with this economic crisis, that number's probably increased significantly, if not moved over to the unemployment side. And as Township Committee Member DeLuca had mentioned, 25% of our population are renters. I'd also like to mention that 18% of our population is foreign-born. So all of those make up how our demographics are impacted by COVID-19.
Right. That's fascinating. Thank you for that breakdown. Let's move on to how we got here. Slides 9 through 12. Some really great graphs there that really show us, they show how long social distancing took to take effect, right? And they really tell the story of the waiting period of this virus based on its incubation. Can you go into that a little bit and walk us through?
Sure. So this is the number of daily new cases in Maplewood. As you can see, some of the days were easier to deal with than others, but you'll begin to see the cumulative on the next couple of slides. So we started our first case on March 14th. This was our first confirmed case that was not related to international travel to China or Italy. And then the cases started to go up exponentially over time. You begin to see around after April 4th, there's a peak and then another higher peak still around April 17th. This actually mimics to the T what the state health department said that the entire state went through, which is the New Jersey state peak was April 6th with another peak around April 17th. And when we ran this data, Anna and I were like, oh my gosh, this is exactly the same numbers that we were seeing. I want to point out that March 21st was when we had the social distancing mandate. And unfortunately, it takes almost a month for any change in society to make a difference in the rates of cases and the hospitalizations and deaths. So I just want to reiterate, it takes almost a month for us to see change. So as we lift any new restriction, unfortunately at the Public Health Division, we anticipate that in a month, we will begin to see cases if people do not continue to follow social distancing practices. However, I also want to reiterate that it is the decrease in the number of cases. That's what is showing what social distancing has done. Without social distancing on March 21st, these numbers would have gone higher. There would be a more prolonged, unfortunately, a prolonged event of cases. The peak would have been later. And this decline, this important decline after April 17th, would not have been possible had it not been if we didn't social distance. As I mentioned, there was this gradual decline of cases by certain types with these restrictions, travel restrictions, stay-at-home measures. All of those made a difference to the number of cases. And again, I'm going to reiterate, if we had not social distanced on March 21st, the number of cases that you see here would have been more every day. The peak would have been later, and we would have had a prolonged number of cases, and you would not see this decline as we see now.
One of the variables here that we should mention also that's playing into this is lack of widely available testing, a lag in receiving test results, and the challenges of contact tracing, right? Limited contact tracing at this point. Can you speak to that as well?
Well, there wasn't really limited contact tracing because that's exactly what we were doing every time we saw any of these cases. However, I will say, yes, that is absolutely correct in terms of the limit in testing. So the testing lag that we talk about in the news media is true and correct. You'll begin to see at the beginning, there weren't as many cases, but as always with more testing, you will get more cases. And most of the cases, about 86% of your cases will be mild to no symptoms, but will test positive. And then you have these confirmed cases, and these are what we're seeing. Actually, they're saying that in certain studies, if you have 14% of your confirmed cases, just multiply that by 7, and that is your actual number of cases in that community. So that's kind of significant. Again, these are just a snapshot in time of your confirmed cases and those who received testing. There's many who have not tested. I'm just going to move on to the total number of deaths. Again, we had 21 unfortunate deaths in our community. And so our first death was around March 29th, which was significant. And then it went up further. Our highest peak of deaths matched the same peak that we had a total number of cases. I want to point out a very positive message here, which is that our last case was on April 23rd. And that's a really significant thing because, again, this is what social distancing can do. Without social distancing, there would be not only more cases, there would be more hospitalizations and more deaths. To provide some context, Maplewood's 21 cases make up only 1.6% of the total number of cases in Essex County, and that was when it was 1,292. So it's roughly about that same number. So again, here's the picture where you can see the total number of daily cases and the total number of deaths side by side together. And here's the total cumulative. So when you see we have, 2 cases on one day, 6 cases on another day, 3 cases on the following day, those are not just 2, 6, and 3 cases. Those are cases that have increased over time and we have to follow it. So at some point, we have overseen 263 cases. What I'd like to say here is that we have 120 recovered cases, but I'd like you to note that if our first case was found on March 14th, it took almost 2 weeks to have a recovered case. So that's significant. And then the recovered cases are following the trend of the number of cases, and our current cases that we're looking at are between the blue and the orange. Okay, so that's our differential that we're currently active and working on and following. What we'd love to see, like you had said, like there's the plateau, but then there's also the coming down. And what we'd love to see if we continue this graph is the orange or the recovered numbers will go up and those positive active cases would go down and they cross somewhere in the middle. That would be the ideal for public health. And we're back to slide 14.
Right, terrific. So can we go a little bit into how the virus works, its incubation period? You sort of mentioned it a little bit there when you were talking about, the 2-week waiting period in between the first case and the first recovery.
Right. So I'm going to go back to the, some previous slides, which is what COVID-19 is. COVID-19 is an illness caused by a virus that can spread easily from person to person. This virus in particular is a new coronavirus, which means it's a novel virus that we have not been exposed to before and has spread globally, which gives it the status of pandemic. Unfortunately, with the symptoms, they can range from mild or no symptoms to severe illness, hospitalization, and death. So the reason why social distancing is important is because 6 feet is the distance of when someone's cough, sneeze, or even when they're talking, their sputum that comes from their respiratory droplets can contact somebody if you stay less than 6 feet. So the 6 feet distance or 2 arm lengths are super important to prevent the spread of disease because this disease can primarily spread from person to person. That is the main source of transmission. Infection may be transmitted by touching a surface, but that's not the main reason. It's person-to-person contact or touching an object that has the virus on it, and then touching your mouth, nose, and eyes. And as I mentioned, anyone can spread it, unfortunately, if they're infected. They may not show symptoms, and everyone is vulnerable. And let me just go back here. So the incubation period of COVID-19 is 2 to 14 days. That means it's the time between the moment of exposure to someone who was sick and then the time to when the first signs and symptoms appear for that other person. The incubation period, a person may be able to spread COVID-19 even if they do not show symptoms and up to 2 days before they begin to show symptoms. So that's why COVID-19 can spread so easily, because even 2 days before we're symptomatic, there's a potential that we're already shedding it. So wearing that face mask and keeping those respiratory droplets away from other people is key and very crucial. The symptoms of COVID-19, everyone has heard about the cough, fever, and shortness of breath. Unfortunately, as we've learned more and more of this virus and we're following up with cases, the symptomology has increased to chest tightness, a very bad headache, body aches, chills. A loss of taste and smell was something that has come up over time as we've been following this. A loss of appetite, sore throat, diarrhea, nausea, and vomiting. While we say that the symptoms are similar to a common cold, influenza, and seasonal allergies, unfortunately, there are other more severe symptoms like pneumonia, acute respiratory distress syndrome, and a new one that we're finding out is blood clots. This disease keeps morphing and changing, is very dynamic. So unfortunately, the blood clots can lead to other issues, side sequelae, like deep vein thrombosis in your lower extremities, a heart attack because the clot is traveling through the body, a pulmonary embolism where the clot lodges in your lungs and you can't breathe, and embolisms that travel up into the brain and can cause stroke. So these are really significant issues and we're watching this closely. Here's some unique characteristics of COVID-19 that I want everyone to understand as we have been doing this for about 7 weeks now. So high susceptibility. This is a novel virus, one to which we have no immunity. While it is related to the same coronaviruses that cause the common cold, it is also related in the same spectrum as SARS. In fact, coronavirus or COVID-19 is called SARS-CoV-2 because it has a relationship to the novel and more deadly viruses of SARS and MERS. So coronavirus or COVID-19 has a spectrum. And we didn't know when we first started what that spectrum, where it lied in that spectrum, but we have more of a clear idea now. the scale of COVID-19 as a global pandemic. This is a global pandemic that we have never seen in our lifetime. It is a one in a century experience. So to that extent, we weren't prepared because we didn't understand what we were dealing with. We did in 2009 have experience with the H1N1 swine flu pandemic, but that was nowhere near the scale of what we're looking at right now. And while it is comparable to the flu, they're not the same. In fact, influenza is one virus type, coronavirus is another. Aside from the fact that they are viruses and that they share the same symptoms, and both can lead to hospitalization and death, the degree to which SARS can cause, COVID-19 can cause it, and flu are totally different. I'd like to say that as flu is our only frame of reference in the United States, when we look at Asia and what they knew was coming, they had experience with SARS in 2003. And so they realized that these are both coronaviruses and they had to be prepared because they weren't sure what this was going to be like. So it's significant that we must not underestimate this virus and continue to compare it to a milder case of flu. It is definitely not that. High transmissibility. This is about speed. So according to an article in Nature, while SARS had a higher fatality rate, which means that it killed more people that it infected, COVID-19 does not kill as many people, but it spreads much more. It's more pervasive in the community. So on that note, let me give you an example. It took less than 2 months from the first COVID-19 infection for the number of confirmed cases to surpass the total number of confirmed cases of SARS over several months. So it's about speed with COVID-19. COVID-19 also spreads more easily than seasonal flu. So again, the comparison is not the same. It's important to note that the replication rate of COVID-19 is about 2 to 3 people. So for every one positive case, and you have to anticipate that there's going to be 2 or 3 more. And that's why contact tracing is going to be so important as we move forward. Once it gets a foothold in the community, COVID-19 unfortunately does not leave. There is no certainty that it will leave in the spring or summer or even with warmer weather. Mr. Osterholm, the director of the Center for Infectious Disease and Research and Policy at the University of Minnesota, said that COVID-19 will not stop until it infects 60 to 70% of the people in any community. Moving to my fourth bullet, which is high rates of hospitalization and death. Because COVID-19 can spread even among people who are seemingly healthy because they're carriers of the disease, and because it spreads so easily from person to person just from respiratory droplets. Imagine being in a large gathering or a stuffed subway car. It is therefore able to cause more illness and hospitalization and death of people. So again, I said everyone is susceptible to COVID-19. Again, I'll reiterate that there are 2 major factors though, but even healthy people can get sick from it, but advanced age and underlying health conditions. And finally, the more important thing is we do not have a vaccine. This will come up in Governor Murphy and the national road to recovery is getting that vaccine in order to create that herd immunity, which vaccines are good for. So unlike seasonal flu and other viruses that we have vaccines for, like measles, mumps, rubella, and varicella, we do not have a vaccine for this or a formally approved standard of treatment. So I want to reiterate why some people ask, why is social distancing important? As we relieve the restrictions little by little, I want to reiterate why social distancing is important. Without a vaccine, social protective measures are the only effective way to control the spread of COVID-19. Please remember that COVID-19 easily spreads from person to person. So therefore, the more contacts you have, the more the contagion risk goes up. So I'll reiterate that again, the more contacts you have, the more risk the contagion goes up. So by social distancing, you are limiting your number of contacts, which is exactly what we need to do. Social distancing, is more than just standing 6 feet apart. It is about limiting the number of contacts you have. So avoiding large groups of people, avoiding non-essential travel, avoiding mass and public transportation, and limiting exposure to places with high-touch surfaces and going out for essential needs only are crucial in understanding. That's why the stay-at-home mandate was so important and so crucial to seeing us see that plateauing and decline in the number of cases. Mr. Daffis, you had mentioned about COVID testing versus antibody testing. So I just wanted to give a brief comparison. They're not the same. So COVID-19 testing is a test that you take if you've been exposed and are infected. Initially, we were only testing people who were symptomatic, but that is no longer the case. In fact, we should probably be testing people who are asymptomatic or show no symptoms as well, given that you can spread the virus even 2 days before you begin to show symptoms. So the test is a nasopharyngeal swab, the long swab that goes into your nose, and it takes a sample, and then it's tested. There is a saliva test that is forthcoming, and that will make testing much quicker. In fact, they're looking at anywhere between 48 hours to even a rapid test of between 3 to 15 minutes. So that will be a major game changer in identifying positive cases and then getting their contacts really quickly. The nasopharyngeal swab takes about 2 to 4 days. So there is a lag time from the time you get tested and showing symptoms, and maybe by the time you get your results, and then by the time we get you and contact the patient, they might already have been recovered. So the saliva test is going to be important. The antibodies. Yes, Ms. Adams.
Yeah, do you have any timeline on the saliva test when it's coming? And it's also much safer for the medical workers because they don't have to have contact with them, right?
That's right. They would just spit into a little tube, and they could run the test from there. So the state has, from Rutgers, they have rapid tests now in a couple of facilities. They have it in Hackensack, and I believe somewhere it's either Robert Wood Johnson and other larger hospital facilities. And they are also using them in state facilities like developmental for special needs people who are in congregate locations. Again, because of density, you want to make sure that the staff and the patients are well in those areas. So they're looking at the most vulnerable. If the tests are working and they're able to generate a good positive case and it's specific and sensitive enough, then they will start rolling that out very quickly. And we're really looking forward to that. And then let me just move on to the antibody or serology test. This is a test that tests if you have developed immunity to COVID-19. So now that you have antibodies, it is a blood sample, and they test your serum, your blood serum for antibodies. You take this after you've recovered, so no more symptoms of COVID-19. And this test allows you to donate plasma to test for antibodies. If you would like to donate plasma and you have recovered from COVID-19, on the township website, we have information on where you can look for plasma donation. And we would really appreciate that because that allows us to look at how many antibodies does a recovered person produce? And maybe we can synthesize those and use that as part of treatment. As I mentioned, these tests are just a snapshot in time. So just because you're negative on Tuesday does not mean you can go to a party on Wednesday, because things can happen and you can become infected. So again, it's just a snapshot in time.
Thank you, Ms. Davenport. What are the chances, how soon do you think we could see more testing sites available, including walk-up locations at your local CVS or Walgreens in our town?
Right. So you had mentioned the Essex County EssexCovid.org website, which is the drive-through for Essex County, and it's free. But it's limited because it's only Monday, Wednesday, Friday from 9 to 12, and we're not sure how long that's going to last. We are hoping that, but it would all depend on those larger facilities like CVS and Walgreens, those larger corporate national entities, to begin to roll that out and do a saliva test. So we are watching that closely. Luckily, we have a CVS in our backyard, and Walgreens as well. So once they start to roll that out, could be as easy as a drive-through, and you just put it in, and then hopefully it'll say, one day we'll get to that place where it'll say, you're positive, please go home and don't go to work and isolate yourself or quarantine yourself. Or it'll say, you're negative, continue on, have a great day. So that would be the ideal.
Terrific. So with everything that we know now, let's move toward the end of our presentation. The path to reopening. What does that look like?
You got it.
And that's slides 18 through 21.
You got it. So as you mentioned, Mr. Daffis, I want to reiterate that this is the governor's message from his office that public health creates economic health. And it just comes down to the basics. If you don't have healthy people, people won't be there to work. If you don't have healthy people, no one will go to a concert. No one will go shop at your store. If we can keep the cases down and if we keep our hospitals viable, public health creates economic health. So I want to bring us forward to Governor Murphy released a roadmap to recovery. And these are the 6 key principles that Governor Phil Murphy announced in his vision, which is the road back, restoring economic health through public health. So again, his office definitely sees the connection between public health and bringing back the economy. So I want to reiterate that there are 6 principles here. One is sustained reductions in new cases. As you saw in the number of daily cases, we were mimicking the state. We have seen a decline in the number of cases as well as the number of hospitalizations. So that's key for them to start looking, which is what they have been, at the 14-day decline of cases and hospitalizations. Principle 2 is expanded testing. As we talked about with and not only antibody testing, but the saliva test and COVID testing, the faster we can get expanded testing, which is the rapid testing, the faster we can get that to people, the more it can be accessible and the more available it is to all communities, the healthier and better we'll be, and we'll be able to have more confidence of going out to the community. Moving on to the 3rd principle, which is the implement robust contact tracing. We would need to, once we get the rapid testing, if, for example, someone is positive, we would then get that test result at the health division, and then we would be able to contact that patient and say, please tell us who you're in contact with in the last day or 2 before your symptoms started. And hopefully, ideally, as we increase these restrictions and as people are going out into the community, that everyone will still be doing some social distancing so that you'll be able to remember where you went and who you had contact with, because that'll be important for contact tracing. We need to be able to reach as many people that you had contact with so that we can contact them and tell them to quarantine themselves. And by doing that, hopefully we will stop the spread of disease. The disease spreads when people don't know that they have it and are not practicing precautions like social distancing and wearing face masks. So robust contact tracing will be key. But of course, these are stacked. One can't happen without the other. Securing a safe place for isolation. This is really for people like our first responders, like those who don't have housing, like those who have people who live in their homes that they don't want to infect. How will we ensure safe places for isolation and healing and recovery? Number 5 is executing a responsible economic restart. And again, that's really looking at what we were talking about with Congressman Payne about providing resources to local businesses, small businesses. How do we replenish downtown Maplewood and bring it back? How do we replenish Springfield Avenue? And open that over time. And then ensure New Jersey's resiliency, which is to look at what can we do better? How do we prevent this? And what can we do moving forward? And of course, making sure that our hospitals and healthcare systems have what they need and are viable to sustain not only COVID cases, but all kinds of other cases like trauma and injuries and things like that. So moving on to what safeguards do we need? This is really all about when can we come back together? So reiterating what the governor's road back policy is increased and rapid, accessible and available rapid COVID testing, a robust system of skilled contact tracers, But I do want to mention that the public's compliance with isolation and quarantine measures is key to the success of this. If people aren't going to abide by quarantine and isolation practices, it's not going to work. So again, the dependence and interdependence of society is really dependent on individual actions and behaviors. Increased healthcare capacity and our standard form of treatment for COVID-19, we're already looking at what can help. Antibodies might be able to help. Antiviral drugs are looking like they can help. Certain classes of medications like biologics are looking to be very promising in reducing the number of cases and hospitalization days that one has and the severity of cases. So that's important and crucial. But if we had a standard, that would be excellent. And then, of course, developing a vaccine and mass vaccination. So moving forward, here are my recommendations. And these are not just my recommendations, these are public health guidances and recommendations. Why does social distancing need to continue? We need to continue social distancing to reduce the number of cases infected. It also, again, buys the healthcare system time to be prepared. And we can't resume a vision of what we had before until we have a vaccine. So always anticipate for the next coming months that some form of social distancing will need to continue. Again, as you reopen things, you don't have to go whole hog, and you really shouldn't. You have to control how many contacts you've had. This is going to be key for contact tracing. So expect that there's going to be stops and starts with our restriction lifting. We might have to pull back on certain things. I advise you to prepare an alternate plan for not only canceling or postponing gatherings and events, but canceling them. There should be a plan B and an alternative on how do we deal with things that may not happen that we expect would happen in Maplewood during the spring, summer, and into fall. Just anticipate that some gatherings may not happen. In fact, gatherings of more than 10 or even 5 are still illy advised. We don't advise those at all, just because the more context you have, the more risk you have. Anticipate a surge of cases with each loosening of restrictions. So in public health, what we do is we monitor the cases, we monitor the data, and we deal with the patients. Anticipate another surge of cases. Every increase in social mobility and opportunity for gatherings, we will see another case. There is no second wave in the fall. I think nationally why they say that is because most companies and states are looking at opening more things like school and their businesses, again, these large gatherings in the fall. So I think what they're saying nationally is to prepare for a bigger wave, but the wave is coming as soon as you open up restrictions. I want to also reiterate that the messaging is not business as usual. Again, reiterating there will be some form of social distancing, gradual openings of various sectors and businesses. People still need to wash their hands after coming in from any public space and wear a face mask to protect those respiratory droplets from getting out, wearing it in any public space. And please avoid visiting elderly or having them visit you and visiting those with underlying health conditions. Unfortunately, they are still very much at risk. And these are our resources for assisting people.
Thank you, Ms. Davenport. This is very comprehensive. As you said, this is a very fluid situation. We want people to stay engaged. The mayor does a great job, as do you, in informing our community daily of what's happening here locally, about resources like this that they can access. I know that you work very closely with county officials and state public health officials, and you will share guidance that you receive about all of this, about public gatherings and public events, summer events, and we will certainly follow what the doctor orders, right? Science equals confidence. Without confidence, it's just not worth risking, another pike in uptick rather in infections and God forbid, deaths. So
yes,
yeah.
Whatever the governor, and I want to reiterate on these resources, there's the second bullet that people may not be aware of, but I know you and I and everyone on the township committee is aware of because we watch them regularly, and all the administrators, is Governor Murphy's daily press conferences, which are on YouTube. Sometimes the times change, but they're usually anywhere between 12 and 1. And so people can follow Governor Murphy's press conferences on his YouTube. Just look for New Jersey Governor Murphy on that YouTube. And you can see where his announcements are. Any announcements that he has that impact us locally, public health is there to support whatever we can do to help open things up, but also do it cautiously and to preserve that social distancing that we need in order to reduce the surge or like large spike in cases.
Wonderful. And I see you also include there the state dashboard for those folks out there who want to dive even deeper into the data. Everything that you could possibly want to look at is going to be there. It's very available. So with that, Mayor, I open it up to questions. Do we have any questions?
No questions from me, but I just wanted to thank Candace for your hard work during all this and for all that information, very comprehensive and also just very plainly and, spoken so that everybody can understand it. And it's really, really great to have you in charge of this. So thank you.
Thank you so much.
Any other colleagues have questions?
Yeah, I just want to say I'm actually going for my test at Essex County tomorrow morning. I jumped on it as soon as they made it available. I think that those of us in public life, we should model our behavior. And I think more people need to be tested. And this is going to be the way of life going forward for a while. So thank you, Candace. I agree with Ms. Adams. You've been terrific in this. I did have one question. I know for normal people, you want to keep a distance of 6 feet. You want to stay further away from politicians because of all the things that we emit?
Yes, stay away. No, I do think that you guys are at increased risk, unfortunately. What you have done with social distancing and modeling that with our town hall committee meetings and all of the meetings that we have in town hall and able to still keep the government functioning is key. But as you move forward, I think the expectation has to be that you can't meet with large groups of people, at least for a while. It's just not the best practice. So people have to understand that there's maybe no handshaking, maybe no large gatherings, no large groupings, but you can still be very active and viable in getting your messages out through these social mediums.
And I just want to add that we have heard from the county today, which highly recommends that people use face coverings when they go outside, period. Not just when you go to areas where you might run into a greater amount of people, like a public park setting, for instance, but just generally when you go out, it's probably a good safeguard. It protects you, it protects others, it protects all of us. So we should definitely get that messaging out to people and remind them to do that. So with that, invitation for the public to address the board. Do we have any public questions?
Deputy Mayor, we have a few public comments if now is the time.
Great, terrific. Bring them on.
Okay, the first is from a Miss Joan Crystal at 4 Quarter Avenue. The question is, what testing accommodations are available for those who have no access to a car?
Okay. If you have no access to a vehicle, Joan, let me get back to you on that information. I know we have drive-through testing. You can also, if you have someone who can drive you to an urgent care center, they will also be able to see you. You don't have to go through drive-through, you just walk in. Just know for everyone, when you go to those urgent care centers, just like in hospitals, only you can go in so that you reduce the exposure of anyone else. So no other, just like in the hospital, no visitors. When you go to urgent care to get urgent care center to get tested, only you can walk in. So that's important.
Okay, thank you.
On that, Joe.
The next question is from a Miss Mary Barman of 41 Plymouth Avenue, and she came a little late to the presentation, so she apologizes. She wanted to know, is there a breakdown by race? And if so, do you also have a neighborhood breakdown of cases?
Okay, so so as I had mentioned, the state holds all of our aggregated data throughout the entire state. It's really the best comparable data for race and ethnicity that you can see, because you can see the full picture in breadth. So you can go to the New Jersey State Health Department COVID-19 dashboard, and you'll be able to see the number of cases by race and ethnicity there. As for locally, we have not done it by neighborhood, only because our focus right now is really on getting people identified, finding their immediate contacts, and then providing them with education and the resources that they need to move on and recover. So that's really our major focus right now. But again, all of that racial and demographic data can be seen at the state level.
Does the state report list for local or just aggregate for the state on race and ethnicity?
I believe that page is just the entire state. I believe that as we keep moving forward and we get time to process the data, more we'll be able to break down by county. But as of now, that's the information. And we take our time when we do the case investigations to ask all of that information, and then that gets loaded up to the state.
Okay, Ms. Davenport, there was a follow-up question by the same person, Ms. Mary Barman, that says, what is the Maplewood breakdown, not the state?
I think we just answered that question, but go ahead, Ms. Davenport. Do you want to underscore that?
Right. So maybe she missed the presentation part of, and I believe that it's going to be released to to media tomorrow, Mr. Davis, but we went over the age range, and we went, which is comparable to the state. We went over the gender, which was also comparable to the state and equal in Maplewood. And trying to think of any other demographic data that we did. We also went over a number of cases and the cumulative number of cases. So that's really what our focus has been at this time.
Okay, Ms. Davenport, one more from Mr. Edgar Galvis McCrae of 37 Boyden Avenue. How is a recovered person defined? Are they getting retested again to see if they test negative? Is that what defines a recovered person?
Okay, so that was an excellent question, one that I didn't get to, but I'm glad you asked it. So when we look at that slide where we showed the cumulative cases and then the orange part, which was recovered, we consider recovered by people that we follow up 14 days after we have made the initial contact. We wait 14 days because, especially if they're living with a household, right? So if they have people in their household, then we make sure that 14 days have passed, which is the full incubation period, and we call them back again 2 weeks later. This is why the system, the process can take a little while, because we actually take our time to follow every patient and their household contacts. We make sure not only have they recovered and have no symptoms, but that no one else in their family has gotten sick. And if they have gotten sick, we don't call them recovered. We look at the whole person, is the whole house. Like, so your family is a unit. You are not a recovered case until everyone in your household has recovered. So that's how we determine recovered cases.
Okay, Ms. Davenport, that's all I have for you. Thank you so much.
Thank you.
You know, if I can just interject for a second, I just want to say that first and foremost, thanks for the wonderful presentation, Ms. Davenport. And Mr. Daffis, great job of also being part of the presentation. But I can't stress enough the amount of work that you and Anna and the team are doing. When you have 263 cases, that's 263 phone calls. That's 263 follow-ups. And that's just not one person, that is them plus 2, 3, 4 in their households. And with the staff of 3, and then some part-time assistants from our school nurses, our residents and our overall press and everyone needs to understand the amount of work, the amount of effort that is coming out of your office to make sure that we, A, stay safe, and B, we have the data that we have. It's unbelievable. And I just want to thank you personally and say that publicly so that everyone understands that we are doing a mountain of work with just a very small, thin, very capable staff. So thank you, and thank you.
Thank you, Mayor. We're very dedicated. We love what we do. We love our community, and this is what public health does: is we look at the community as our patient, the whole entire community, and so we will continue to do so and help everyone and assist as we open up the economy and open up our society even further.
Well, tomorrow is beginning of Nurse Week, and I could not see any better individuals than yourself and Anna and the whole team, being recognized in this coming week.
100, I agree with that.
Thank you.
Ms. Davenport, do you have any closing remarks?
No, I just want to say thank you so much for the time you give to the Board of Health monthly meetings. Public health is super important. I really feel from the bottom of my heart that you all recognize it. So I want to thank the administration, our department heads, the township committee for giving us the time to explain this to the community, because I think it's super important. So, and thank you, Mr. Daffis, for facilitating the dialogue of that conversation.
Wonderful. Thank you, Ms. Davenport. And with that, I move to adjourn our Board of Health meeting tonight. And we're scheduled to meet again on Wednesday, June 3rd.
Second.
Ms. Fritzen, please call the roll.
Ms. Adams,
Yes.
Mr. DeLuca,
Yes.
Lembrick,
Yes.
Mayor McGehee,
Yes.
Mr. Daffy.
Yes.
Thank you.
Thank you, Ms. Fritzen, and thank you, Deputy Mayor Daffis. We are now on agenda item number 10. We have an introduction of a new ordinance.
Mayor, item 10, introduction of a new ordinance, ordinance number 2997-20 is an ordinance to amend chapter 257 of the Code of the Township of Maplewood entitled Vehicles and Traffic. This ordinance will designate a parking prohibited at all times area located in front of the property at 775 Prospect Street.
Ms. Adams, may we have a motion, please?
Yes, I move the passage of this ordinance on first reading, its publication according to law in the Maplewood South Orange News Record, and a hearing to be held on May 19th. Is that right?
Yes.
Okay.
Second.
I
Ms.
have
Fritzen,
a
please.
question.
Oh, question.
Yeah, if you don't mind, Mr. Mayor. And I may be alone in this, but I just like to know a little bit of background on this. This 775 Prospect Street is that near St. Joseph's Church, or is that
Mr. Lembrick, Mr. Lembrick, Roger Desiderio, the engineering department had requested this because the residents at that property are infirmed, and there were people parking in front of their home, and it was difficult for them to get in and out. So they had requested that the engineering department indicate this to make it easier to be accessible for them, and that's the genesis of the resolution, of the ordinance, rather. I'm sorry.
Okay, and in that case, is this something that would stay on the books permanently, or is this something we would revisit at some point if there's different residents?
I believe
Well,
it's.
No, go ahead.
I was just going to say, we recently passed a similar one for a handicap spot in front of a resident for that particular resident. So we do it on occasion, and then obviously, when it's no longer necessary, but this one might be necessary for a while.
Okay, all right, yeah, I just wanted to understand the background of this. I appreciate the explanation. Thank you.
Mm-hmm.
Ms. Fritzen, please call the roll.
Ms. Adams,
Yes.
Mr. Daffis,
Yes.
Mr. DeLuca,
Yes.
Lembrick,
Yes.
Mayor McGehee.
Yes, and thank you, Ms. Fritzen. We are now on agenda item number 11, also introduction of a new ordinance.
Yes, Mayor, ordinance number 2998-20 is an ordinance to exceed the municipal budget appropriation limit and to establish a cap bank for NJSA 48-4, 45, 14.
Mr. DeLuca, can we get a motion, please?
Certainly, I move the passage of this ordinance on first reading, its publication according to law in the Maplewood South Orange News Record, and hearing to be held on May 19th, 2020.
I'll second that. Ms. Fritzen, can you please call the roll?
Ms. Adams? Ms. Adams?
Sorry, I
You're on mute.
forgot I was muted. Yes.
Mr. Daffis?
Yes.
Mr. DeLuca?
Yes.
Mr. Lembrecht?
Yes.
Mayor McGee?
Yes, and thank you, Ms. Fritzen. We are now on agenda item number 12, the 2020 municipal budget. So we will have our, I'll just go off, just say briefly that we're going to have a little more of a deeper conversation here as we go into number 13. Obviously, the last couple of weeks we've discussed the budget and some of the challenges with COVID-19. There's been a lot of effort that's gone into this budget. It's been very thoughtful. We will continue to monitor the situation. Our chair, Mr. DeLuca, will go into some more specifications about the timeline, which is uniquely different from years in the past. And with that, we will go on to agenda item number 13. Mr. DeLuca.
Thank you, Mayor. First thing, if anyone's looking at the published agenda, it says a hearing is going to be held on the budget on June 2nd. It's going to be held on June 16th. So just to be clear, we're going to be introducing the budget tonight. We'll be having a hearing on the 16th. And between now and then, there may be changes based on the ramifications of the coronavirus and how it has hit our revenue stream and even our expenses. But tonight we are introducing a budget of $48.2 million. That's about a 3.5% increase over our budget for 2019. The tax increase is 4%. The property tax increase is 4%. We did the best we could in cutting down on expenses early on this year when we had our hearings. The average house is assessed at around $500,000, and the increase for the average house for the local portion of the taxes will be about $165 or $14 a month. So that's an average home, and you can do your 4%. But if you're hearing this and you're thinking about a 4% budget increase, it isn't your total taxes. It's just the portion that goes to the municipality, which is about 25%. So some of the drivers, and I'm gonna put up and Glenn, you're gonna be able to put up that chart. Let me just tell you some of the drivers.
Yeah, just let me know when you look it up.
Okay, thank you. We had a significant increase of over $200,000 for our capital improvement fund because we're undertaking a fairly robust program of infrastructure repairs. We have a fairly difficult time keeping up with our roads and our sewers, our public buildings. We made a decision this year to really stop kicking the can down the road and doing some of those repairs. So that has increased our budget by about $200,000. We have already spent over $100,000 just responding to COVID-19. So that's something that we're going to have to, hopefully we'll get reimbursed by FEMA, but that reimbursement could be a couple of years down the road. This year we had to open up salary negotiations with all of our bargaining units. And so that also added, a significant amount to our annual budgets. Our insurance costs went up about $250,000. And in general, as you'll see, if we could just put that up there now, Glenn. There we go. So basically, the majority of our dollars are spent for police and dispatch and fire and the Office of Emergency Management. So you see there about 31%. Our DPW is next. That's the next biggest as far as operating department. So yeah, stick with that. So if you just go right around the circle, you can see the cost. Our pension, debt, health benefits, and so that's where our money goes. And primarily, our spending is on salaries. We're in the service business. So when you say, we're cut here and cut there, and we're going to have to think about that as we go forward, we're talking about cutting our public safety. That's where the money is. A lot of these other pieces of the pie are statutory. We don't have a choice, for example, of pensions or health benefits or even debt payment or even the sewer authority. So it shrinks as to how much we can even look at when we're talking about cutting appropriations. But we are going to take a look at that between now and June 16th and see what we can come up with. And in addition to the spending side, let's go to the revenue side. We did utilize about 75% of our fund balance this year. We anticipated 98% of our revenue from prior years. So you can see that most of the money, 67%, comes from local property taxes. There's also, you see that little 3% there is for library property taxes. And just to give you what that means is, by state law, the library has to receive a minimum of local property taxes based on based on value and a certain minimum. The minimum for Maplewood is $1.45 million. We provide $2.14 million, nearly $700,000 more than what's required by law, and that's because of the value that we have, we believe in, of the library. So the big green here, 21%, that's the scary part. And if you go to the next slide, local revenues, local sources, and it really comes from these big items, fees. We're talking over $10 million here in local sources of revenue. The fees are from our jitney, parking, recreation, sewer, construction, planning and zoning, Board of Health, Public Works, even the emergency medical services when we send out our EMTs. So all those fees are taking an enormous hit right now as everything is closed. People are not going into New York City. Construction has stopped. So those are, and of course the recreation, we're not running any programs right now. Licenses, those are Board of Health license for restaurants and daycare centers, and also for liquor license and things like that. Those should pretty much come in as budgeted because they're annual fees. Payment in lieu of taxes, we have a few of the properties that we've have contractual relationships with. The good news is that those will come in. We expect 100% of those. That's about $1 million in total. And then court fines and costs, that's also taking a significant hit because our courts are closed or just have been closed until, I'll report a little later, up until this week. And then, of course, rental of municipal properties. All the time, people rent the DeHart Center or the Woodland or Bergdorf. That money does add up, significant amount of money there. So that's also going to be taking a hit. So again, we're asking the Township Committee to introduce this budget, $48.2 million. You heard before we had that conversation with Congressman Payne about our hope that another piece of legislation will get passed by Congress that will provide financial support and that will bring it down to the level of population that we're talking about here. And just, if I might just go off a little bit on a tangent, this is why the census is so very important to us. Because if we don't have a real number of people that live in this town, when some of these funding sources come down, we get shortchanged because all of our people aren't counted. So if you know of people who haven't, or you just want to, as you're walking around with your mask on, if you just want to go up to people and say, and stay 6 feet away and say, did you do the census yet? That will help us, because if we have a good census, those numbers will be used for some of these calculations on federal aid. We're also going to be talking to Essex County. They got some money from the CARES Act. We'll see how they're going to appropriate those dollars. And of course, we will be submitting our reimbursements to FEMA for any costs related to the COVID-19. So that's where we are right now. In a nutshell, it's still a work in progress. And but we would hope that we could introduce this tonight and allow us to keep working on it and come back in June with a little bit more informed sense of where we're heading. And that's it.
Thank you, Mr. DeLuca. And again, thank you. And as I stated, a lot of work has been put into this budget. It was basically, in a great position, and then COVID-19 hit, and we nearly start all over again. So I'd like to recognize Mr. Golowski and his team, Mr. Veros as well, who sit on the Finance Committee with Mr. DeLuca and myself. And we will continue to look at it, be very thoughtful, and also leverage any resources we can at the county, state, and federal level. Okay, so now we'll look for a formal resolution to introduce the budget. Mr. DeLuca.
I move the adoption of resolution 110-20.
And I will second that. Ms. Fritzen, can you please call the roll?
Ms. Adams,
Yes.
Mr. Daffis,
Yes.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee.
Yes, and thank you, Ms. Fritzen. Okay, we will now move on to our 15th. Well, actually, we will skip our 15th agenda item, which is reports from departments, and we'll roll it up into agenda item number 16, which is administrative reports. And we will first hear from our township administrator, Mr. Veros. Mr. Veros.
Thank you, Mayor. I have not officially submitted this report, but just to recap what I will do in the next couple of days. It's quite a lengthy document, but I think it's going to be helpful for each of the township committee people to relate to our forward thinking in the long term, even after restrictions are lifted in some sense. We're thinking that a business is not as usual, and we're thinking about doing business much different also, whether it's physically, whether it's virtually, but we have a game plan. So as you know, the governor did provide principles, and I worked alongside those principles to demonstrate locally what we're going to do. So first, demonstrating sustained reductions in new COVID-19 cases and hospitalizations. Those are state identified, but also Maplewood identified. And as we heard from Ms. Davenport in her robust report about how she's been tracking things, we rely on her to give us that information and that input. And that's how we start to think about where we are with the curve, with the plateau, and so forth and so on. So we're going to use the public health information and the guidance to plan for the future. Secondly, expand testing capacity. I think we would be in a good position locally to work with local private facilities, work with our neighboring townships, Irvington, South Orange, Union, Milburn, and even Newark, to try to help everyone here. And I think it goes to say that even on a local level, create a regional committee for us so we could establish a better way, because there are significant disparities between certain demographics within the township. And I think it leads to say that if we create these partnerships, it will help even the larger cities like Newark and Irvington. Third, implement robust contact tracing. So Candace has done a really fabulous job with that. And so we're going to continue to do that. But in addition, we have to also create better systems for Candace. And what we've just recently done is put her on the spatial data platform. So that will help her department and some of the efficiencies there. In addition, we want to make sure that we have our own supplies for those residents that have been impacted. You know, we've gotten little care packages, so we want to make sure that we have the supplies and that for this contact tracing, whether it's, you know, we just recently purchased additional thermometers, so that I think would go in with that third principle. Fourth, secure safe places and resources. Now, as the OEM team, we discussed on many of our meetings that the Hart Community Center is our shelter in place, if you will, for our community. I think we need to start thinking outside of the box, that it is also a safe place for those who are seeking shelter, the homeless, those who really don't have anywhere to go, and that potentially creating that space as a means of mitigating whatever it is they're going through. And, you know, one of the things that happened here was the group that we had at the Hart, Mr. Daffis will know, that was there doing some mental health awareness and consulting. And, you know, I think we've expanded it there, and I think we need to expand it now for public health and creating that as our shelter in place. Our OEM building is the safe space for our first responders. We've established that. So those are our safe places and resources. I want to make sure that we, in the next year or two, we do procure a generator for the OEM building, in addition to radios. Right now, the fire department, the EMS staff have created a decon station in the garage. So they've established that now, and we're really using it fully. So I'm proud to say that everything's getting good use. The fifth principle: execute a responsible economic restart. So this is on the long-term planning, and along with creating safe spaces throughout our public facilities. It'd include sanitizers, creating clear barriers. We have some really historic buildings, so we need to work together with historic preservation, so that we both understand that there's a new crisis here that takes precedence. So we need to work together to make some of these structural things happen. Creating a intercom system in the finance area, so that there is still a close contact, even with the glass that's there. You still do have a projection of a person, you know, with I don't want to go into the fluidness of how close you are with someone, but that it is pretty close. So we want to start to invest in that. I would also alter our cleaning services bid, and adding once a month deep cleaning treatment of all our township buildings. So those are some of the things I'll have to think about when we're contracting out with the cleaning company. Reopening of the buildings would happen once Governor obviously lifts some of these restrictions, and even then we'll have to create safe spaces in those buildings, and we're working on that. By then, we'll have a better setup with barriers. So we're doing the planning now to work alongside DPW. However, I recommend enhancing and heavily promoting an online platform of doing business, processing permits online, which we were ahead of the game here, I have to say. So we continue to have forms online that are ready available. I mean, our court's been a really great example to facilitate having equal access to all with the processing of pleas, and even what they're creating now with the virtual sessions. So that would be the responsible way to open up and still make sure we continue social distancing. And then the last principle that the governor talked about was ensuring New Jersey's resiliency. So much like the state, locally, we need to keep responsible stockpiles and continue to create and enhance our playbook for the future. Although we're not necessarily ready or feel confident that we can open up to the public necessarily, we need to establish those systems now to make sure that we're not at a large disadvantage come the future. So you will find individual operational plans here for each department, but overall, I want to make sure that we're doing the right thing. We're doing what our governor has established here. I don't think we need to reinvent the wheel in that sense, but we need to locally here think about what we could do to help even our own neighbors. So it's a heavy document, but I think you'll really appreciate that everybody put a lot of thought into what they think a new way of doing business is going to be like.
Thank you, Mr. Veros. Yes, I mean, I look forward to receiving the document. And thank you for the effort. I mean, it was very robust, so I took some notes. Any questions for Mr. Veros from my colleagues? Okay, so will you be sending that document out the next couple of days?
Yes.
Okay, thank you. Mr. Desiderio.
I have no report, Mayor.
Thank you. Ms. Fritzen. Ms. Fritzen.
Sorry that I'm muted. Can you hear me now?
Yes.
Okay, in the last few days, I was able to get the new timetable for the 2020 primary election. And I think it'll be important to get the dates out there for people for primarily the new date that you must be registered to vote for by to vote in the primary election. So we'll post all that up on the township website. Also, what the new date is for the deadline for a mail-in ballot. So all of the dates now were obviously changed to compensate for the change of the primary election to July 7th. I also just wanted to mention that, yes, the township clerk's office continues to work well and improving weekly through experience of serving the Maplewood public. People are, I feel, able to conduct business and feel satisfied with the treatment that they're receiving from not just the township clerk's department, but I think all the departments within town hall. So the latest for registrars in New Jersey was the governor reinstituting marriage licenses and the ability to conduct ceremonies. So myself, I am a registrar, but I am not the registrar for Maplewood. I'm the deputy registrar, but obviously I'm involved in the associations and things. So I've been researching with my colleagues as to how they're going to approach taking licenses. Suggestion was made, yes, they can be done on Zoom. People that are getting married would have to participate with the registrar or deputy registrar, produce their documents via Zoom, and proceed that way. And we have at least one marriage at the end of the month, and it seems like we're going to go that way and have that happen. They have secured their own officiant, but again, it's all new waters to tread. But again, I think that in the township of Maplewood, we're forward thinking and able to serve the public in this and all the other tasks that we have. And that's it.
Thank you, Ms. Fritzen. Does anyone have any questions for Ms. Fritzen? Seeing none. Thank you again. And that
Thank
will
you, Mayor.
conclude. You're welcome, Ms. Fritzen. That'll conclude our administrative reports. We'll now move on to agenda item number 17, reports from elected officials. Mr. DeLuca.
Thank you. Got 5 things. Tomorrow morning, the Springfield Avenue paving work will begin, and that'll start at the Boyden Avenue intersection of Springfield and go to the Irvington line. That work was supposed to be done last year, but we ran out of good weather, so it would be done now. On May 14th, the Township Committee is going to have a video presentation of the Burnett Avenue traffic calming plan. So we will be putting out information. It'll be at 7:30 on Thursday, May 14th. And it'll be a WebEx, similar to what we do here for the Township Committee meeting. So look for on social media and look for our website. We'll be doing some emails to some groups who have, some individuals who have come to our last few meetings. I'm happy to take Joe Manning's role and say that the farmers market will open on June 1st from 2 to 7 p.m. at the Springfield Avenue site. And we will be using appropriate social distancing and non-contact with food products. Our administrator and assistant administrator are working at a plan, working with the farmers and with the state to come up with guidelines, and it'll be a little different, but we'll be there starting on June 1st.
Mr. DeLuca, part of our report, there is a deep plan on how the farmers market will operate. So that'll be part of this report also.
Great, thank you. On May 21st, which is Thursday night, which is the third Thursday of every month, is Hilton Neighborhood Association meeting night. And since we can't do it in person, we are going to have our first video meeting highlighting Mayor McGehee and Candace Davenport. So we will be doing that at 7:30 on Thursday, May 21st. We'll be talking about COVID-19, all things COVID-19, the census, the budget, and anything else that the hordes of people that will be watching might have a question about. And lastly, I'm happy to announce that during the week of May 18th, we will be submitting our $8 million plus library grant application to the state of New Jersey. So we're working on the final details of it, reading it, checking everything, because this is a one and done. You can only submit it once, and once it's in, you can't even go in and change it. So, hope just think positive thoughts. The week of June 5th is when the deadline is. So, then that's it.
Thank you, Mr. DeLuca. Mr. Limbrick.
To report tonight. I do have a question, and I now regret not bringing it up while Ms. Davenport was on the line earlier, because she might have had some ideas. But I received a communication from Boy Scout Troop 5, and they are willing and eager to do something to assist the community at this time. And I told them that I would ask around if there was anything the township needed or any organizations that the Boy Scouts would be able to help with. Obviously, we would need to take into account, their health and safety and not put them in a position where they would be at risk. But, if anyone, from the township is aware of potential volunteer opportunities right now for our scouts, they really would like to give back and do something in the community to help us through the ongoing issues, and particularly those who may be vulnerable during this time and less fortunate to help them. If there's anyone out there watching tonight who's part of a community organization, who's looking for manpower or boy power, as the case might be. Scout Troop 5 is looking for opportunities. So with that, I really don't have anything else to report, but I wish everyone well. Stay healthy, stay safe, and thank you, Mr. Mayor. That's my report.
Thank you, Mr. Limbrick. And just for the record, one initiative that's going on right now is led by Jake Ezzo and his assembly team, and they're assembling shields for first responders, technicians, nurses, doctors, and so forth. And so I know you can probably find the information on social media, or I could text you his number offline. And he might be looking for some young individuals to join the assembly team.
So that's the 3D Printer Alliance, right?
Yes, it is.
Okay, that's great. Yeah, maybe I can put those two in contact.
Perfect.
Thank you, Mr. Mayor.
Thank you, Mr. Limbrick. Ms. Adams.
Yes, thank you. I actually don't have very much to report either. I was going to, Mr. Daffis mentioned during that Board of Health meeting, but I guess it's worth reiterating that Saturday, the Soma School District Parenting Center is doing food distribution through MEND at OLS, Our Lady of Sorrows, from 8 a.m. to 11 a.m. on Saturday. So it's drive up only, no registration needed, and everyone is welcome. And I was just gonna, I don't know, Mr. Lembrick, you might want to also confer with Mr. Mcclowsky and Mr. Veros. I was in meeting with them in going over operations and way to make the farmers market work and be safe. So there might be a potential for scouts to be where the queuing the line of people going into the farmers market to make sure they're 6 feet apart, so that the people going into the market are 6 feet apart. I know we'll have DPW there and some other staff, but there might be an opportunity of volunteers. I know in my work, we have some volunteers helping with the Summit Farmers Market, which is opening on Sunday, Mother's Day. So might be something they could do there. So
thank you.
That's my report, Mayor.
Thank you, Ms. Adams. Mr. Daffis.
Thank you, Mayor. Lots going on, but I'm just going to focus on one update this evening, and that relates to resolution number 108-20 that we have on the consent agenda this evening. As soon as we adopt the resolution, we will be officially awarding our Wi-Fi contract to DNS, Data Network Solutions, an internet services provider that has experience in public Wi-Fi programs in other cities and towns. We're excited about this. We're moving forward. Earlier this evening, I saw that our township attorney, Mr. Desiderio, formalized and completed the contract with DNS, and that is also attached to our resolution this evening, or rather incorporated therein. And I invite Mr. Michalowski and Mr. Desiderio to provide an update. Essentially, what this looks like is we have everything that we need to move forward. We have the contract with the provider. We've ordered the 2 poles that are going to go up in and around the Seth Boyden area, one of which is going to be on Seth Boyden itself. We have a collaboration and partnership in this regard with Seth Boyden. And the school district is also, in working with Mr. Paul Roth, going to help us identify the 78 to 100 families on free and reduced lunch that would be prioritized in this first phase of our Wi-Fi outreach. And Glenn can speak to the technical aspects of what this is going to look like on the ground. Roger can speak to some of the legalities involved as it relates to end user agreements and access to homes. And I invite them both to say a few words if they might.
Roger, would you like me to go first?
Sure, absolutely, Glenn.
So on the technical side of things, I was in interviews all day, so I have some correspondence to catch up on for tomorrow. But to date, the DNS, the vendor, has been on site at Seth Boyden, performing the installation of the first antenna. Is there feedback? Okay, hold on.
Mr. Desiderio?
If I understood everything Glenn just said, I would agree with him. Notwithstanding that fact, we seem to be moving along fine. I saw some communications today between our network provider and American Tower about the installation at American Tower down on Boyden Avenue. They seem to be working through things. We'll have the agreements in place, and we should be ready to go. So I think that there's progress being made, and as Glenn said, the whole project's taken longer than I think anybody anticipated, but we seem to be right on the precipice of getting this thing done, or at least not done. Maybe that's not correct, but at least significantly started.
And I thank you both. You've been incredible. Ms. Viveras wants to chime in, I see. Go ahead, Ms. Viveras.
I just like to add that the school has been great to work. Well, the Board of Education, Mr. Paul Roth, he had a lot of institutional knowledge on the IT part of this, and he actually connected us to DNS. So I do want to extend our thanks to the administration on the Board of Ed, and they've been really cooperative and they've been helpful. So another great collaboration. So
Absolutely. Thank you, Mayor. That's the extent of my report.
Thank you, Mr. Daffis, and thank you, everybody, for your efforts on this project. It was a long time coming, and it now is at a great place at a very important time. So timing is everything. So we need it now more than ever. So I had really two things, and so now I have one. I just wanted to say thank you to to our township team, our engineering group especially. We're continuing to run the town. The town is functioning, and as Mr. DeLuca talked about, some of the paving that's going to be happening over on Springfield Avenue. I just wanted to take a second and show you all some of the work that's already been done on Boynton Avenue. And this picture was sent to me today by a family that are close to Meadowbrook Place and Boynton Avenue. That's the OEM building in the back. And it's pictures like this that make you really feel good about the work that we do. They were concerned about their pedestrian safety. They had reached out to probably all of us. And through the work of Mr. Kittner and his team, as a result, that's the finished product. And when I received this email today, it made my day, made my week, especially during these times. So I just wanted to say thank you to the engineering team, to San, to everyone, to Roseanne, to everyone, all their hard work, because even under these times, we're still working for the better good of our community. And that is my report. So I will now move forward with our three discussion items. Our first discussion item is the tax grace period extension. Mr. Barros.
Mayor, just to touch on this, the executive order that was just recently passed, which extended the grace period for payment of taxes. Now, that said, typically there's a 10 calendar day, so the grace period would end. The second quarter taxes are due on the 1st of May. That was this past Friday. They are still due on the 1st of May. The grace period, however, has been extended until June 1st. So on our consent agenda, we do have that to be enacted and to have that provided to our township residents. I think it's in conjunction what we recently did with the partial payments. I think that in an effort to continue to help our residents who are going through the same things as we are, this is another step in the right direction to try to get that going. So I think this is a good effort on everyone's part to do.
Thank you, Ms. Riveros. I know we have it on the consent agenda. I'm wondering if we should even get there. And Mr. Desidero, what do you think? If we should pull it out and vote on it separately, or just leave it in there?
Mayor, I'm sorry. Did you pose that question to me?
Yes, I did. Sorry.
Yeah, I think it would be a good idea to do that. Yes.
Okay. So what we will do then, Ms. Riveros, we will pull that out of agenda item 19, vote on it separately. But before we do that, is there any discussion?
None from me, Mr. Mayor. Do you want that? Are you calling for that motion on resolution 112-20 now, or do you want that to be done at the time of the consent agenda?
You know what? At this point, it's probably okay to do it now at this point. And then we go to the consent agenda. We'll just go 1 through 5 and then 7 and 8. So why don't we do that, Mr. Limbrick?
Okay, thank you, Mr. Mayor. So I will do that and I'll also move the consent agenda later, and that will also tee up potential discussion if anyone has any. I'd like to move the adoption of resolution 112-20 authorizing extension of the second quarter grace period for property taxes.
Second.
Ms. Fritzen, any discussion? Hearing none, Ms. Fritzen, please call the roll.
Adams,
Yes.
Daffis,
Yes.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee.
Yes. Thank you, Ms. Fritzen.
Thank you.
And thank you, Mr. Veros. We will now move on to discussion item number 2, issuing of new liquor license through historical method. Mr. DeLuca.
Thank you. So I sent an email out to you all, basically laying out what you all know is that we went out through the public sale option twice, once in December 2019 for 500,000 minimum bid, and then again in March 2020 for 350,000 minimum bid. We got 0 responses on both of those dates. There is another option. It's called the historical method. I put here the sections of the law. It basically, people fill out applications, just like they would for a liquor license. It's the liquor license application. And we, at a public meeting, review all those applications and pick who we think would be the best in the public interest. I think there needs to be some more investigation of this, and I would like, if we're interested, to be authorized to work with Mr. Desiderio and Ms. Fritzen in contacting the state ABC, because I'm not sure that we can put regulations or restrictions on the historical methods, such as we want it on Springfield Avenue, or there's a minimum bid or minimum price that we would accept. So if we're interested in moving forward with something like this, I would just look to get some authorization to continue working on it. If not, we can just wait and do another public bid at some future date.
Thank you, Mr. DeLuca. Is there any discussion?
I was just gonna.
Go ahead, Nancy. Go ahead,
Okay.
Nancy.
I was just gonna say, now it's not quite a market for a liquor license at this time, since we don't know what's going to happen to the food and beverage industry after this dilemma or pandemic we're in. So I have no problem with Mr. DeLuca working with Mr. Desiderio to research this and see what our options are, but I don't see any pressing amount. I don't see anything happening with a liquor license sale at this time.
Thank you, Ms. Adams. Mr. Daffis.
Thank you, Mayor. Vic, I wanted a little color, if you will. So I, of course, yes, look into it. Yes, please. Absolutely. But I wonder, was this something that fell out of favor or is this something that we could have done all along? I'm trying to assess the pros and cons of using this approach.
It's something we could have done all along. This is something, according to the ABC literature, it's not used much anymore. I think because liquor licenses have generally been very easy to sell at public auctions. So you have that, I guess, that market there where people are going to bid it up. So this was allowed to us before. We just never pursued this. Again, I think we need to find out a little bit more if there are any pitfalls here. For example, one thing is it's pretty clear on a public bid, if you have the high bid, you get the license. With this, there's a subjective element involved. The governing body would have to agree to giving the license. And if someone gets rejected, they're entitled to go to the state ABC director and appeal that. So it's a little different than just just a sealed bid and opening it up and you get it because you have the highest amount. So because it's a little more subjective, it may have fell out of favor by all parties. And just the one comment that Ms. Adams made, I agree that this may not be the time, although I did get approached by someone who owns a building there who their tenant is going to probably leave. And they were thinking, well, rather than bring another tenant in, maybe I would be interested in opening up a bar. And we've talked to a couple other people who have been interested in doing some things there. And this may be a time there may be buildings that are going to be sold. It's hard to know. So I think sort of being nimble here is going to be in our favor.
Totally agree.
A while back, when I spoke to the ABC, they really don't like this approach because it's fraught with legal, the real possibility of litigation, quite frankly. So, I mean, I understand that it needs to be explored, but I think the answer to your question is, and I think Vic has answered it, it is certainly disfavored. And I just would like to remind everybody that, one of the things that you did on 2 occasions is put a minimum bid in. You never opened it up and just said, okay, put a bid in and let's see what we get. So, that might be a third option. I'm not suggesting not to explore this, but without putting a number on it, you might get some interest in the license as well. I mean, my concern always is, and I've always suggested this, is that to try to have as an objective approach as possible. So if in fact you're going to go down this road and we're going to do this, I think there should be at least some understanding of what the objective criteria is going to be, or some type of objective criteria to make a determination on who's the best. That's right. Really it. I mean, you five can each have a different, I'm sure you probably do have a different idea of what would be best. And that creates a difficulty, especially in a public forum, to be able to make an ultimate choice on who it's going to be. So just my thoughts, but there's certainly no reason not to explore it.
Mr. Lindbergh.
I think I agree with the consensus here that I see no reason we shouldn't explore this. I think we've now tried a few times, under different circumstances and conditions to do this. It may be that after this pandemic situation is over, and we have a better sense of what the market is, it may be that going out to bid yet again in the same way we've done before is productive. But in the meantime, I think there's certainly no reason that we shouldn't explore other options that are available to us under state law, and see whether or not that might be a better solution for us to use this liquor license in a way that will benefit our community. So yeah, I'm for letting Mr. DeLuca and Mr. Desiderio and anyone else from the township who's going to be looking into this to go forward and come back and let us know what they find out, and maybe have a proposal for us.
Thank you, Mr. Lindbergh. And yeah, thank you, Mr. DeLuca. Let's explore this. Let's see what happens.
Okay.
Thank you. Discussion item number 3, Mr. DeLuca, Office of Emergency Management update.
Yeah, so I thought it would be appropriate, since we had the very, as we described, the robust report from our health officer on the things that have been happening and what we need to think about. I just want to assure everyone that we are making plans and being very cognizant of the ramifications of those plans. And I want to start out by quoting a famous person, the boxer Mike Tyson, who said that everybody has a plan until they get punched in the mouth. And we certainly had plans, but we got punched in the mouth by this coronavirus. But we are now, and I might say, our Office of Emergency Management, all of us on this call right here, we had our first meeting in mid-March. We were the first municipality in Essex County to declare a state of emergency. We met on March 12th. And then again, we met on March 15th. Just from the 12th to the 15th, everything exploded and changed. And if you remember, we brought in South Orange and we had a meeting at the OEM building and started making some plans. And we were ahead of the state and the governor. And then we meshed our plans together. So we are now moving into sort of the next stage aspect of planning. And we want to continue to do. I think that's one of the hallmarks of our community, is that we do planning. We do pre-construction plans before we do projects. We do pre-event plans before major events happen. So this is some planning that we're doing now as the Office of Emergency Management. We had our first meeting last week. On Monday, on the 4th. We met last week, Friday, and we got the report on the 4th. But we went over the situation with the municipal court. So right now, the municipal court is working virtually, and they did 10 cases last week, and they're moving some up this week. So we haven't gotten that report, but they will be moving virtually. And then we talked about what would be the plan if, in fact, there are going to be in-person court events. And we've talked about proper protection for everyone, and also protection not just for the workers, but also people coming to the courts. So I wanted to assure people in the community that we are making these plans. We have upcoming, we have this week, we're going to be talking about elections and how to make the plan so that people who are both working at the polls and those who may be voting, if in fact there is in-person voting on July 7th, that we're prepared for it. And then we have a meeting scheduled to talk about the library. And then lastly, we have a meeting to talk about all the things related to community service department, including the camp, the pool, the programming, the use of Bergdorf, Woodland, DeHart, the senior building. So we are thinking about what is going to look like as we move forward. At the same time, we're working with the Chamber of Commerce, the Maplewood Village Alliance, and the Springfield Avenue Partnership to talk about some of the business concerns and business areas that we're going to have to think about as we open up. So we are doing planning here. We yesterday issued an executive order or declaration that we are suspending overnight parking restrictions through Sunday, May 31st. And so the entire month now, we will allow overnight parking. We may be coming to an end at the conclusion of that month, but right now you'll be able to go through the 31st. And I'm happy to report that we have finally started to receive some personal protection equipment from the county OEM after some pushing and prodding. But we were able to get some stuff both at the police department and our health division, and our fire department's been talking about getting some supplies that we can share with our public works. So we are moving forward. We're making sure that all the things that we heard Ms. Davenport talk about as we move forward are built into our planning, and figuring out all the aspects here so that if and when we open, all of us will be as safe as possible. That's it.
Thank you, Mr. DeLuca. Thank you very much, and thank you for thinking thoughtfully about the plan, not just as we were ramping up, but also as we discussed very thoroughly how we're strategically thinking about, reopening and re-entering into the new, not as business as usual, but the new normal. So thank you for that. Any questions for Mr. DeLuca? I can't see everybody, so I'm assuming I'm seeing all these head nods. Okay. Hearing none, we will close our discussion items for this evening. We are now on agenda item number 19. This is the consent agenda. I would like to entertain a motion to approve items 1 through 5 and 7 and 8.
Mayor, I was not at the April 7th meeting, so I cannot vote on number 7, the first part of number 7.
Understood. So what I will do is I will entertain a motion for agenda items 1 through 5 and number 8. And then we'll come back to number 7. How about that?
Mr. Mayor, what I'll do is I'll make a motion to approve items 1 through 5, item 7.1, and item 8 on the consent agenda.
Perfect.
Was that your motion?
Yes.
I second it.
Ms. Fritzen, please call the roll.
Ms. Adams,
Yes.
Mr. Daffis,
Yes.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee.
Yes, thank you, Ms. Fritzen. Mr. Lindbergh, can I have a second motion?
Yes, Mr. Mayor, I'd like to make a motion to approve item 7.1 of the consent agenda.
Okay, get a second.
Second.
Thank you. Ms. Fritzen, please call the roll.
Ms. Adams,
Abstain.
Mr. Daffis,
Yes.
Mr. DeLuca,
Yes.
Mr. Lembrick,
Yes.
Mayor McGehee.
Yes, thank you, Ms. Fritzen.
I will note that that meeting was like one of the shortest ever township committee meetings I had to miss. Saying.
Yeah. We're making up for it tonight, aren't we?
Yeah. No, it's almost like you just combined April 7th and May 5th.
Exactly. We are now on agenda item number 20, public comment on any subject matter. Walls, do we have any comments?
Mr. Mayor, you have one public comment. It is from Miss Mary Barman of 41 Plymouth Avenue. It is for Mr. DeLuca during his financial statement. It states, Vic, you said we are talking about cutting our public safety. Are you projecting cutting positions in the police and fire department?
I didn't say that. I said that the 30% of our budget goes for public safety. And most of that is for salaries. And if we were to start talking about making cuts, that is a serious conversation we'd have to have, because it's something we don't want to do. So that's why we're holding off as much as possible to try to get resources from outside, looking at the budget we introduced tonight to see if there are alternatives, because the last thing we want to do is to cut public services, public protection, safety.
Yeah, and I just would add on to Mr. DeLuca that, yeah, I mean, that's, we're recognizing where that is, there's an expense there, but we're not recognizing because we want to cut it. We're just recognizing as a fact. We're not, that's not what we're saying. But we also are being thoughtful. We're looking at everything. So we're looking at everything, but we're not saying that wasn't the narrative that was communicated tonight.
Other than that, you have no other public comment.
Thank you. All right, we'll now close our second public comment, and we are now at agenda item number 21. I will entertain a motion to adjourn.
So moved.
All right, it's been second, please.
Second.
All right, all in favor?
Aye.
Aye.
All right.
See you at 8 a.m.
Yes.
Good night, everyone. Thank you. Thank you all.
Everybody.
Night.
Good night. Thank you.
You can kill the YouTube next.
You got it.